Hello, hello. Welcome, everybody. Please come on in. Let us know where you are streaming in from. We will be starting the broadcast shortly. Hello, everybody. Welcome to the Fibromyalgia Community Conference. Good morning, and a very good morning if you are tuning in from my time zone. I'm so excited to welcome everybody to the day two. Day two, we have 8 more days to go, and I'm just excited to be here this morning. We have a great lineup prepared for you as well. This is live. We are live, very much live in production for this conference. So the unexpected may occur, just to let everybody know, but we may have to take breaks periodically, but stick around. It's a good time to take a stretch break, use the restroom, grab a snack, and we'll be right back with our regular content should that happen. But in the meantime, too, please connect with everybody in the comments. This is a great opportunity to connect with community members around the world, chat with people, share some information, get to know everybody here. We are connected, and comments are coming in from Facebook, YouTube, X, formerly known as Twitter, and StreamYard. So there's a great opportunity all over the internet. Please share this content with other fibromyalgia patients that need the updated education and need the community support, because no one fights fibromyalgia alone. I am Melissa Talwar. I am the executive director of the Support Fibromyalgia Network. I'm also a board certified functional medicine health coach. We are a national nonprofit organization here at the Support Fibromyalgia Network. We provide patient education, medical education, advocacy training, collaborative care, which includes group health coaching, and expansion of research. So we have a lot on our plate that we're actively working on. So we encourage everybody out there to get to know us, ask questions, because we have a lot of plans for 2024. And today I'm joined by my wonderful co-hosts who actually are very familiar with a lot of our programs and have been involved, especially with our advocacy training. I have Danielle and Danielle. So this is going to be a fun way of saying who am I talking to, and I have to remember and figure it out. So we have one Danielle streaming in from North Carolina. Why don't you give a shout out and say hello to everybody tuning in?
Hey, I'm Danielle Patilli, so DP. I am a patient advocate, fibro warrior, and I'm just so excited to be here to co-host. I'm a science nerd, so I'm really excited to hear Dr. Pinkston and hear her presentation. And I can't wait to hear everyone else this coming next 8 days. I don't even know. We're on a second day? Yeah. So
yes. It's only day two. And look, I love this. So dynamic Danielle duo. Okay, we're going to have to say that over and over again throughout the conversation. I love that. Thank you, Carrie, for tuning in. We'll also get through all the comments too during break. So keep posting, keep up with the hashtags. So it's hashtag fibromyalgia conference, hashtag fibro nerds. That is going to be the winning ticket throughout the conference for some giveaways that are upcoming. Now, Danielle Goodrich. So you're streaming in from New York. Why don't you give a shout out to all our fibromyalgia friends out there?
Oh, hi, I'm Danielle Goodrich, patient advocate from upstate New York. I'm also a lab tech by trade, so science is also my jam.
Yes, we have some science enthusiasts on the stage. This is cool. And there is talk that we're going to have more scientific conversations for those of you that want to tune in and enjoy that. We'll welcome it because we want to talk about research and advancing research. So I don't want to have to delay the presentation any further. So our first guest, which I'm delighted that she's joining us this year once again, because she had a phenomenal presentation last year. Everybody is loving it. They're still watching it. So it is available on YouTube and social media platforms. So you can go back to watch the 2022 conference, including Dr. Pinkston's presentation. So I'm so glad we're going to bring her on. She's going to present. We're going to have some Q&A with her as well. And I'm excited because she has some news for us too. So let's bring on Dr. Pinkston. Dr. Pinkston is a board-certified rheumatologist. She is on a mission to empower women and men with fibromyalgia to live their best lives. She combines the power of mind-body connection, neuroscience, pain education, and coaching. She provides evidence-based tools that you need to take control of your healing and improve your quality of life. So let's bring up Dr. Pinkston to the stage. Hi.
Hi.
Good morning, Dr. Pinkston. Welcome to the Fibromyalgia Community Conference.
Thank you so much for inviting me. I'm just excited and stressed out.
Oh, no. We're going to talk a lot about the nervous system.
Yeah.
So. Well, it's tough doing it live, but you see all the people in here too. So the nerds are here. I don't know, Dr. Pinkston, do you relate to any nerdiness in the science side of things?
You know, I'm a nerd from, I think since I was born. You know, my father was a physics teacher. My mother was a physician. So I was like always in a nerdiness since I was a child. And then my undergrad was computer engineering and my husband is an engineer. So I'm surrounded by nerds. And even my kids are nerds.
Oh, this is awesome. So you're in the right spot. You're surrounded by, and then you're welcome here. That's why you fit in so well with us.
Thank you. Yes.
And we're excited because everybody's tuning in and you have a wonderful presentation prepared for us today. And where are you streaming in from?
I'm streaming from Louisville, Kentucky.
Yay! So all of the warriors in Kentucky, please give a warm welcome to Dr. Pinkston. I'm going to put your presentation on the stage and let you begin, and we will have a Q&A afterwards. We're ready to go? Okay, here we go. Now you can change the slides. You're good?
Yes.
Okay.
You can see me and I can see the slides.
Yeah, and Danielle, and myself, we're going to move backstage and we're going to let you get to your presentation. So
thank you so much.
But we're here. We're not going anywhere. So if you need anything, anybody out there, please let us know.
Thank you. Well, thank you everybody for joining in so early in the morning. I'm so excited to be here once again. And this is a great platform for patients, patient advocates, any clinician who provides fibromyalgia care. And I welcome all to tune in and listen. And thank you again for allowing me to present to you. So this is a part 2 of the presentation. The part 1 was last year in 2022, and it's available on YouTube. But I really wanted to elaborate on the nervous system and the emotions and the physical health. Last year, the presentation was more about the nervous system and how our nervous system is connected to some symptoms in fibromyalgia. Today, I want to make a more general connection, not so nerdy in terms of the neuroscience, but what happened to you and why you may have fibromyalgia, chronic pain, or any other chronic conditions. I want to talk about the relationship between the emotional and physical health and how stress and trauma affect autoimmune conditions, chronic pain, and fibromyalgia. Again, this is short disclaimer. This is for information only. I'm a physician, so I don't want to have liability. And I also want you to take this as information for your health so you can actually research further the topics I'm discussing today and maybe bring it to your doctor because this is important information that physicians should be aware of. Again, I'm a board-certified rheumatologist and internal medicine physician. I graduated from the Mayo Clinic in Jacksonville Rheumatology Fellowship that is known worldwide for fibromyalgia care. I'm currently a fellow at the Andrew Weil Integrative Medicine Fellowship. And I also have many hours of additional training in pain science education, PRT, trauma, CBT, IFS, somatics, nutrition, and lifestyle. So again, this is from last year, living in survival mode, how your nervous system may be dysregulated and how it can affect immune system, fibromyalgia, and pain. So if you want to have more information on that, please go back to the Fibromyalgia Community Conference replays from 2022. Now, I know I'm very excited and a little stressed out. So I want to kind of take care of myself, and I want you to take care of yourself. So maybe we can just take a pause and take some deep breaths, just kind of regulate ourselves a little bit so I don't speak so fast. So if you can take deep breath to the count of 4, and then hold it for 7, counts for 7, and then release it slowly to the count of 8. So take a deep breath, hold it for 7, 1, 2, 3, 4, 5, 7, and take a deep breath out, 1, 2, 3, 4, 5, 7, 8. Take a deep breath again, hold it, let it out. Again, take a deep breath, hold it, and one more time. Hold it and let it out. So hopefully it will help you kind of regulate your nervous system a little bit more and pay attention. I have many references that I use for this presentation. Many books, many courses. Some of them I don't note as references, but if you have any questions, you can always email me or look up those wonderful people who gave a lot of information on this subject. So we're going to go over some concepts today about what is stress, and then how stress affects our body, and mitigation of stress and the effect of this on our health. So what is stress? I want to tell you, stress is universal, and everyone experiences stress every day. Stress is just our body's response to pressure, challenges, or anything that comes up. It's a natural human response that prompts us to address challenges, threats in our lives, in our environments, with other people. We have many types of stress in our lives, but we have 3 types of stress that we can identify. One is eustress. It's a good stress. It's motivating. It's inspiring. You know, if we get stressed out a little bit to motivate ourselves in January to start a new diet or exercise program, when we travel and change our environment, when we have a job interview or this presentation, or if we're dating somebody new, have a new relationship, or have a gathering of people that you love for Christmas or holiday or birthday. This is all example of good stress. It inspires us, but it activates our nervous system a little bit to make us do stuff. So we don't lay around and not do activities. Kind of makes us going and move through the life. Then we'll have a neutral stress or new stress. It is kind of information we can receive that kind of stressful, but really doesn't affect us. It can be news you read in the newspaper, for example, volcano eruptions in some island or tornado that did not affect your community, something that is neutral, but it still can be perceived as stress. And this is distress. This is the bad stress that most of us think about. Anything that perceived as threatening. It can be work-related stress, the traffic, it can be your mother-in-law visiting, anything that activates your nervous system in a negative way. Now, there are many types of stress, but we usually identify stress as a short-term or long-term. Now, short-term stress is intense and it goes away rather quickly. It can be travel-related stress when you miss your flight. It can be loss of a job. It can be flu or any other infection that has a short, resolution. It can be a fire in a neighborhood or that affects you or somebody else you know. And it can be trauma. It can be shock trauma, such as somebody who robbed you or assaulted you. So this is a short-term stress that's intense, but it goes away rather quickly. And then we'll have a long-term stress. This stress is chronic, ongoing. It may arise either intensely or less intensely, but it lingers. And your body feels that it's perpetually aroused for danger. Instead of having a fight or flight response to a tiger in the wilderness, when it's there very quickly, it either eats you or you run away. You feel like you're living with a tiger in your living room. You continuously having the fight or flight response of your adrenal system or your hormones, your nervous system is activated, you have symptoms of activation, and that can go on for years. And that stress, we're going to talk about today, how that ongoing, long-term stress affects your health. Now, we have many, many stressors in our lives. Again, a stressor is a situation, circumstance, or stimulus that is perceived to be a threat. Now, it doesn't have to be a threat. And what's threat to one person may not be a threat to somebody else. Now, stressors alter the balance in the body, how our hormones regulate, how our body functions, how our mind functions, nervous system. It alters the balance in the body. So we may have psychological stress, our thoughts, beliefs, perceptions. Our thoughts cause a lot of stress. Our thoughts create feelings that lead into actions and the result. So if your thought is extremely stressful or creates a feeling of threat in your body, will create a feeling or emotional response or physiological response that will create a result in your body. Your heart rate may go up. You may have some, sweaty palms. Your mind, your body can get activated. So psychological stressor is a thing. If you're thinking about losing a job, just think about it. You don't know you're going to lose a job, but you think that you may. That thought creates anxiety, creates stress, creates symptoms, even though it has not yet happened. Then we have physiological stress. This stress is, again, we not think of as stress, but any illness, infection, any disease, hunger, or pain is a stressor. When we have infection, not only we feel horrible, it creates a physiological response in our body. We also have consequences of illness, missing job, it disturbs our social environment. If you have children, it creates additional stress that is maybe social or psychological, but physiological stress does alter your body. It can create heart rate elevation, create effect on your immune system. It can cause pain. So physiological or body response is there's also stressors of that type. Social stressors are very common. It can be anything from traffic or commute to work. It can be major life changes like having a baby or getting married. It can be good stress or bad stress, but there are stressors. Personal conflict, arguing with a spouse or your children or having teenagers, financial insecurity. Those stressors affect our daily life. And also, if they're prolonged or lingering, if we're constantly living in the conflict either at work or at home, if we're constantly stressing out about finances, paying our bills, if you have daily commute to work and from work that is in traffic, that's heavy traffic, when you have, danger, irresponsible drivers around you, it creates a stress response in your body with your hormones going up, with your body, with your heart, with your lungs. So social stressors are common and have profound effect on your body. And then we also have bioecological stress, the weather, pollution, food additives, chemicals. Those things also affect our body in a negative way very often. What we eat matters. If we eat chemicals from fast food or colors that are added to our sprinkles or cereals, even though we don't perceive it as a stress, it is a stress that affects our body. It puts our body sometimes on a defense, again, alters our hormones, our immune system. Another stress is trauma. Now, trauma, I can tell, just like stress, is universal, and I will talk more about it. But trauma is anything that is too much, too soon, or too fast for our nervous system to handle, especially if we can't reach a successful resolution. It may be too much arguing when you were growing up at home. It may be too soon being exposed to sexual behaviors of others, such as pornography or somebody's advances. It may be too fast, experiences that came on too fast that you couldn't understand or handle, especially if you didn't have somebody guiding or helping you through that event or series of events. Again, trauma is often not about the event. It is about the individual response to that event. Not every event will cause that response in every person. If we have a fire in the classroom, the effect of the fire on the kindergartners, the teacher, and the firefighter will be different. The teacher may be stressed out about keeping her students safe. The students may be fascinated, but also stressed out about that fire and evacuation. And then the firefighter will be all activated to go and fight the fire. But the response on their bodies, their memories, their perceptions, their arousal state will be different. So trauma is not about the event. It's the body's reaction. Again, we have two types of trauma. And most of us think of trauma as a short-term trauma. It's intense, it goes away quickly, it may result in PTSD or post-traumatic stress disorder. We think of it as shock trauma. Those are the plane crashes, school shootings, somebody gets assaulted. That has happened, it's horrible, but it has a defined time frame. Now, most of us, or many of us, may never experience the shock trauma or short-term trauma, and it's a good thing. And I'm sorry that if somebody had experienced the short-term trauma. But most of us, or many of us, have experienced long-term, chronic, ongoing threat or danger. Again, this is when we live with a tiger in a living room, when we have this survival response, the fight or flight response that is ongoing. Again, just like trauma, just like stress, trauma is universal. But also, I just want to point out, it can be multi-generational. I have many patients who will tell me, my childhood is perfect. I don't have any recollection of any trauma as a child or as an adult. But they may have multi-generational trauma from slavery, the Holocaust, forced migration, violent colonization. It's a lot of things that can happen to our parents or to the baby in utero. We now know that if mother experienced a lot of stress through pregnancy, if she lived in dangerous neighborhood, if she worried about her safety, if she worried about providing for her children with financial insecurity, if she lived in a dangerous environment with dangerous spouses or significant others, that baby had exposure to show stress, and it affected the baby. So trauma is universal. It is what it is. We have survival responses. Our bodies were designed for that. But unfortunately, it has health consequences. Many of them are reversible. So I want to give you hope. If you feel like this is all I'm telling you is a gloom and doom, I want to tell you it is not, but it helps you understand maybe why you may have fibromyalgia, chronic pain, in other health conditions. Knowledge is power. So my conversation today is about empowering you to know what may have happened to you, why. Many patients who see me in the clinic, they want to know why. Why do I have fibromyalgia? Why I'm in so much pain? Why I always feel stressed out? Why I have rheumatoid arthritis or lupus or other autoimmune conditions? Why? So this hopefully will give you some answer of why stress and trauma affects our health. So this is important information that a lot of times is missing in the conversation with your doctors. And I don't even remember covering it in the gazillion amounts of information in medical school and other training. If it did, it wasn't important enough or big enough news for me to remember. Adverse childhood experiences should be foundational knowledge that every physician, every clinician, every physical therapist, any provider of healthcare or childcare or teacher should know, understand, and use. So childhood trauma and adversity that happened before age 18, from zero, actually before zero, in utero, to all the way to age 18, plays a major role on our health. Again, what happened to you before age 18 has negative consequences to your health when you are an adult. We're not talking about health of children. We're talking about health of adults. This study came out in the 90s from California insurance company called Kaiser Permanente and the CDC. So they studied over 17,000 people in California who all had health insurance, who were usually, most of them were middle class, not living in a horrible neighborhoods or, in danger. They were studied and analyzed about their health as adults, and they studied their childhood, and they used different scales of analysis to see what happened to them as children and how that presented, or how it affected them as adults. And this study is still ongoing, and this study has been replicated in many other states and countries around the world. So this is not just one study or one example. So this study started in the 90s, but it's actually being used as the model to study chronic diseases in adults in many other countries and cities and states. So that study used a scale of 10 adverse events or ACEs that may happen in somebody who is a child, again, from 0 to before age 18. If it counts 1 point for any of those experiences, so if you had multiple, multiple experiences of verbal or physical abuse, it still counts as one event. Physical abuse, verbal abuse, sexual abuse, having sexual contact with somebody older than you by 5 years or an adult, physical neglect, emotional neglect, losing a parent to separation, divorce, or death, a family member who is depressed or diagnosed with other mental illness, a family member who's addicted to alcohol or another substance, a family member who is in prison, witnessing a mother being abused. Now, in later studies, they expanded this scale to include a father being abused by a mother, a sibling being abused, witnessing homelessness or unstable housing, discrimination, bullying, any hunger. So they expanded the scale, but this scale was used in the initial study, and is still kind of the classic screening for adverse childhood experiences. Now, you can easily Google the scale ACEs and calculate it and see how many you may have, how many adverse childhood experiences you may have. I want to also tell you there's another scale that's very important, actually multiple vertical scale called resiliency scale. The scale is also important and should be taken probably at the same time as the ACE scale, because sometimes when you take the ACE, it makes you so sad and depressed, but the resiliency scale shows you how many good experiences you had in your life. So they can actually show you how having a grandmother or somebody like a mentor in school or a friend, those experiences also count towards your health and towards your outcome. But today we're focusing on stress and trauma. Again, this is how your adverse childhood experiences may cause health outcomes in the adult. And the study found astonishing results. Almost 2/3 of people, 67% of the entire population, has at least one traumatic experience. How often are divorces? Very often. Half people get divorced or even more. How often we have somebody in a family who has depression, anxiety, or mental illness. So we may not perceive it as adults now as trauma, but it is. We know that having divorced parents as in adults causes health consequences. Having a parent or somebody in your family with mental health issues or addiction, like alcohol addiction. Talk about 60s and 70s. How many people consumed a lot of alcohol because it was normal, or other drugs? Now those children are adults today. So if you look at the scale and look at the consequences to our health, again, 67% have at least one ACE. 1 in 6 experience more than 4 ACEs. 4. And the consequences of health are traumatic. At least 50% or 5 out of 10 leading causes of death. Again, 5 out of 10 leading causes of death in the world associated with ACEs. This is the health consequence of enormous health consequence. If you have 4 or more ACEs, you're more likely to have lung disease and be smoking. You may have more suicide attempts or thoughts of suicide. You're more likely to have depression, liver disease, drug use, have sex before you're age 15. This is real. This is there's evidence for it. Somebody can measure it. It is studied, so it's not imaginary. Stress, trauma causes diseases of adulthood. Now, potential reduction of negative outcomes in adults. So this is again from CDC. If we reduce childhood stress, if we reduce those ACEs in our children, how much better their health will come in the future. Again, this is ongoing studies, so we're kind of looking at the numbers. They may not be as impressive, but again, 44% reduction in depression, COPD because people smoke less. Smoking goes down by 33% when we reduce the stress in children. Heavy drinking reduces by 1/4. Unemployment, finishing high school, having health insurances all improve if we reduce stressing our children. But if you also look at these health conditions that are studied, you will see that depression, COPD, asthma, kidney disease, stroke, heart disease, heart attacks, cancers, diabetes, obesity, if they're studying reduction of that, it means the ACEs are causing those conditions. We're not going to study reduction if there was no connection between those conditions. So ACEs are linked to chronic health problems, mental illness, substance use, and problems in adulthood. And we know through decades of research that ACEs have risk of causing development of chronic diseases and behavior challenges in adults, including obesity, autoimmune diseases, fibromyalgia, and chronic pain. If you have more than 2 ACEs, your risk of autoimmune diseases, chronic pain, fibromyalgia goes higher. Diabetes, heart disease, cancer, poor mental health, alcoholism, and reduce life by as much as 20 years. So again, childhood stressors causing adult diseases, and many of them are preventable. And then if you are having all these conditions, or again, childhood stress or any other traumatic events, it will impact your education, job opportunities, earning potential, that also will increase your stress in adulthood. But what about ACEs and fibromyalgia? Now, there have many studies. I didn't pull up all the studies, but if you search ACEs and fibromyalgia, you will find many studies. There were studies in 2012, 2010. There's a lot of data coming out in those years. But recently we had in 2020 a large-scale population-based study that reported that childhood trauma is associated with significantly higher risk of developing fibromyalgia later in life. Another study in 2022 found that 88.2% of people with fibromyalgia had experienced childhood trauma. Now, this is not a surprise, right? 1 in 20 people in the world may have fibromyalgia. I think the number is underdiagnosed. And 1 in 6 people have more than 4 ACEs. 1 in 4 women had a history of sexual assault, and 1 in 6 men have history of sexual assault. So if you look at amount of trauma and stress that is experienced by humans, again, it is universal. We can understand why so many people in the world have experienced chronic pain and fibromyalgia and chronic fatigue syndrome and other health consequences. Again, looking back at common fibro triggers, this is just a reminder. I put trauma as number 1. I have not met one person yet in my clinic who have not had some type of trauma, some type of ongoing or severe stress. Many of us had infections, severe infections, hospitalizations. COVID is a stressor. Now we can add that to the list. Many have prolonged hospitalizations. Medical trauma also is a thing. Going to a doctor for 3, 5, 10 years and not getting diagnosis, and finally getting diagnosed as fibromyalgia with all the stigma and all the mistrust in the community, it is traumatizing as well. Injuries, car accidents, whiplash, falls, fractures, childhood sports-related injuries, all are common triggers, identified triggers of fibromyalgia. So we'll look at stress, trauma, and our health. And again, those are very common triggers for fibromyalgia. So how does our body respond to stress? Our body was designed to have this response to stress when we're being hunted by a tiger, right? When we lived in a primitive time, a primitive, caveman world, and we did not experience the ongoing stress that our modern society experiences. So our body has this pre-wired fight or flight response. And this was the talk of my presentation from last year. Stress response is wired in our body for a reason. We're supposed to experience stress. Remember, 3 types of stressors. We're wired to have good stress, with neutral stress, and distress. So our stress response is not, is wired. Our body is designed to experience this. It's a part of our autonomic nervous system response. And that is involved, it involves our hormones, our heart, our vagus nerve. Everything is related in terms of how our body responds to stress. But the major mechanism is of this stress response is hypothalamic pituitary adrenal axis activation and release of the acute stress hormones of epinephrine and norepinephrine, and also release of cortisol or chronic stress hormone. And many of us know that those concepts. But what about the symptoms? Many of us have experienced them. Right now, I'm a little anxious because I'm giving presentation. I'm sure my heart rate is up. I feel palpitations. I speak faster. I have shortness of breath. I have sweaty palms. Those symptoms of stress are common. If you ever had a test, if you ever had stressful interaction in traffic, if you had somebody visiting you unexpectedly, you may feel those symptoms. But those are kind of short-lived, symptoms that tell you that your nervous system is activated. Many people feel the symptoms chronically, ongoing. Again, anxiety, palpitations, shortness of breath, sweating, irritability, fatigue or excessive tiredness, loss of appetite or increase in appetite, overeating, dizziness, nausea, indigestion, diarrhea. Almost 100% of people who have fibromyalgia also have IBS. Headaches, tremors, unusual emotional feelings, difficulty sleeping, night sweats, or nightmares. Those are stress-related symptoms that many people have all the time, not only when they're acutely stressed, but chronically stressed out. Then also there's psychology of trauma. How many symptoms, psychological symptoms, we have experienced or experiencing because of history of trauma that has not been processed, healed, or reframed. Anxiety, depression, dissociation or daydreaming, dysregulation of the nervous system, insomnia, hypervigilance, waiting for the other shoe to drop, being aware of your surroundings 24/7, being mindful or watchful of people's expressions. Are they having a good day? Are they going to hurt me? Are they happy, unhappy? Are they going to be loud and argumentative? Hypervigilance is a very common symptom of childhood trauma or ongoing stress. Numbing with alcohol, food, sugar, drugs, pain. When you're stressed out nonstop, it stresses your muscles. It puts your nervous system, activates all the muscle response and posture and your skeletal system. It is a known cause of pain. If you're stressing all the time, you will have more tension in your neck, in your back, in other muscles. So pain and again, the tension, the cramping is very common. Also, blame, shame, feeling of betrayal, attachment issues, attachment problems with childhood, how you relate to others now, diminished self-care, loss of hope. Many of my patients report me many or all of the symptoms, and many or all of these symptoms, physical symptoms, psychological symptoms. So if you have those symptoms or the activation of your nervous system due to stress or trauma for a long, long time, sometimes it's not that long, it may be just a few months or years, but often people will not, again, 0 to 18 is 18 years, and then stress of being a teenager or adolescent and then young adult. No wonder we start seeing consequences of that stress in our 30s, 40s, or sometimes younger. We have children who have ulcers and other health issues, but we see that propagation of bad health through the years. The longer we live with stress, the more conditions we will accumulate over time. Health effects of chronic stress: impaired immune function, more infections, autoimmune conditions, arthritis. We see that it also affects inflammation. Inflammatory conditions are common. Inflammation has many functions in our life, including prevention of diseases like cancer, cardiovascular disease, infection reduction. So impaired immune function and inflammation causes a major effect on our health. Decreased bone density. Many people are surprised by that. Osteopenia, osteoporosis, again, all those hormones are affecting your bones. Problem with memory. Now, there's no direct cause of dementia from stress, but we know that people who have more stress often have memory problems and dementia. Dementia can also be part of the inflammation, and just like cardiovascular disease. So again, if you have problems with inflammation, problems with heart disease, and other consequences of inflammation, you may also have dementia. So, but problems with memory, the brain fog is so common. Again, if you're hypervigilant, if you're constantly scanning for danger, if your body is aroused, it diminishes the available neurons in the brain to process other information or store memories. Increased appetite is seen in ongoing stress. Again, when we have sometimes acute stress, we don't want to eat. People say, if I have the flu, I may not eat anything for 3 days, I'll lose weight. But ongoing stress, we see that weight gain, obesity, abdominal fat deposition, increased appetite is very, very common. Insulin resistance, increased glucose and cholesterol is very common. We also know that the depression and diabetes often connected. We see patients who have type 2 diabetes often have depression, and depression is an independent factor for heart disease. So again, insulin resistance, increased glucose, cholesterol, increased blood clotting, and platelet dysfunction, impaired wound healing, poor sleep, sleep disorders, pain and fatigue, poor mood or mental health disorders, cause of development of blood pressure, high blood pressure, hypertension, diabetes, heart disease. Stress causes disease. Adaptation of less healthy habits and substance use, and decreased lifespan, not because of all the substances or other health issues, but because our telomeres or our DNA gets smaller. So we know that it's not just all the issues causing our shorter lifespan. But if you look at fibromyalgia symptoms, just to connect the dots, all the symptoms we'll talk about, we see in fibromyalgia patients widespread pain all over. People tell me muscles hurt, joints hurt, even my skin and hair hurts, touching hurts. People have stiffness, fatigue out of proportion to age and activity, exhaustion, malaise, headaches, tension headaches, migraines, dizziness or lightheadedness, problems with thinking, memory, concentration, brain fog, sensitivity to touch, smells, bright lights, or noise. This is overstimulation of the nervous system. The nervous system cannot handle so much input. Episodic numbness or tingling, difficulty sleeping, unrestful sleep, insomnia, sleeping too much, not getting enough rest, difficulty falling or staying asleep. As you can tell, those symptoms are real, and many of them can be related to the ongoing stress or the past history of trauma. So what do we do with this information? What is your call to action? I want you to be empowered by this information. I don't want you to take this information and say, there is no hope. My fibromyalgia is here for good. There's nothing I can do. My pain is going to be here forever. I want you to take this information and empower yourself to do more for yourself, to do more for your health. Because health is a state of complete physical, mental, spiritual, and social well-being. It is not mere absence, prevention, or control of disease or symptoms. Again, having no fibrous symptoms is not health. Having, again, complete physical, mental, spiritual well-being, how well are you living your life? You are not your disease. And there's many things you can do to improve your overall health. Some conditions may be already taking toll on your health, but many of them are still reversible and modifiable. Again, looking at the potential reduction of negative outcomes in adults. If you look at, that 88.2% of fibromyalgia patients have childhood trauma, they also experience these conditions, right? So if you have fibromyalgia, you may also have depression or COPD because you smoked, or you may have a higher risk of stroke or heart attack or cancer or diabetes. What can you do for your health? Not just for fibromyalgia. What else can you do to offset all those conditions? Now, I don't want to diminish suffering from fibromyalgia. And many patients who have fibromyalgia feel powerless because they are in chronic pain. They're often tired. They're struggling with the symptoms. But putting all emphasis on fibro and ignoring these other health concerns that are modifiable, reversible, treatable is important. Your nervous system may have been dysregulated for many years. You may feel disconnected, threatened all the time. It impairs your breathing, digestion, healing, mood, blood pressure, sleep, hormones. But we can also regulate our nervous system. We can start regulating our nervous system now by taking breaths, having deep breathing, by starting yoga. Yoga Nidra is a phenomenal tool to regulate our nervous system when everything else feels dysregulated. Taking 20, 30 minutes per day of Yoga Nidra showed that you have more nervous system regulation, better sleep, more dopamine in your brain, just doing 20 to 30 minutes of yoga per day. Eating proper nutrition, healing your digestion. Again, stressors. Bad food is a stressor. Improving quality of food removes that stressor. Exercise, moving your muscles. Again, with fibromyalgia, we know that too much exercise causes pain, but gradually increasing movement, gradually improving circulation in our muscles creates, again, positive response to your nervous system and reduction in pain. Has been studied by Mayo Clinic and many other organizations or studies show that physical activity improves depression, chronic pain, and fibromyalgia symptoms. So this is not just my talk. This is from the VA system in the United States. VA system, or Veterans Affairs organization, has this concept of whole health. And I came across with this past summer. I guess, again, I've learned about it before, but it was really impactful when I was learning integrated medicine through my fellowship. And it's, they talked about how our health, how our whole health has impact or on our lives. What is whole health? Again, this is from the VA. Their concept is not just prevention and treatment of disease or conventional complementary approaches. Look at it. The disease management is the outside. It has much smaller proportion of your health than this concept of me, mindful awareness, moving your body, your surroundings, personal development, how well you live and work, what you eat, what you drink, how much you sleep or recharge, your community, family, friends, co-workers, relationships, your spirituality. Spirituality has a huge impact on your health and often not talked in our healthcare system. A lot of patients crave spirituality discussion with their providers, and it's missing. Power of mind, relaxation, healing, yoga. As you can tell, this is you, and this is what you can do or improve. This is the circle that is your conditions. That is fibromyalgia or heart disease or whatever diseases or symptoms we might have. And then community is important. We don't live in isolation. So this is the concept of whole health by the VA system in the United States. Me, self-care, professional care, community is whole health. And I wanted you to pay attention to this because a lot of patients who see me complain, my doctor doesn't listen to me. I go to so many doctors and no one knows what's wrong with me or what to do with me. The medications don't work. The consultations don't help. I did pain management, it didn't help. But if you look at this concept, only 1/4 of your whole health depends on a professional care. Now, I don't want to minimize it. It is really important. Medications save lives. Heart stents save hearts. But a lot of it is in your control. You have more control of your health than you think. This is the lifestyle medicine, American College of Lifestyle Medicine interventions. This it's a medical specialty. You can take a board exam on this. It is how can you reverse diabetes? How can you reduce your risk of heart disease, high blood pressure, cancer? The studies are phenomenal of reduction of cancer rates using those lifestyle modifications. again, they're focusing on non-medicinal, non-pharmacological treatments that should be offered to every patient, regardless of disease, initially. So if you have diabetes, before we put you on metformin or insulin, those should be offered and used before the medications. Healthy nutrition, and lifestyle medicine proposes whole plant-based foods. It can be also Mediterranean or autoimmune protocol. Dramatic effect on our health. We can reverse diabetes by and impaired glucose by using nutrition. Physical activity, important. Doesn't, there's a prescriptive physical activity, but some physical activity, improvement in sedentary lifestyle is so important. How you manage stress, how you sleep, what kind of relationships you have, and how you can improve it. It can be, family, it can be extended family, it can be going to places of worship, community, again, relationships, and avoiding risky substances. I know that many of my patients, especially I live in Kentucky, smoke, use alcohol, use other drugs to numb the emotional symptoms. But also, food addiction is very common, overeating, stress eating. So I'm kind of lumping all those risky substances in this big category of doing risky behaviors that affect your health. But if you modify or reduce or improve, those, those focuses, and again, nutrition, physical activity, stress management, sleep, relationship, your health will also improve. Your symptoms of every condition you may have, including fibromyalgia and chronic pain, will improve. I have not met one patient who told me, I have done all of this and I don't feel better. You will feel better. I'm not sure to what degree. I'm not sure for how long, but the more consistent and focused we are on those modifiable lifestyle interventions, the better our life will be. All right, this is the end of the show, or the end of my talk. Melissa, are you there?
I am here. Thank you so much. Let's bring everybody back. What a wonderful presentation. Thank you for sharing with us. And I know that there's a lot of questions and comments that have been coming in as well. And shout outs to you too. So thank you for the presentation. And then I saw Danielle and Danielle backstage taking notes. So I'm going to let them actually take the lead with some of the Q&A as I give shout outs to people, because everybody's so excited to have. Again, I think sometimes with this conference too, it's surprising that doctors want to talk. So we're appreciative of all of the medical physicians that have come in to share information.
Thank you.
So let's start off with Danielle Goodrich for the Q&A part.
Hi, Dr. Pinkston.
Hi.
Awesome presentation. That was so informative. I know one of the questions that we got from the audience was, is fibro a physiological condition? I know a lot of us go to doctors and some of our doctors are like, hey, this is all, just in your head and you can just make it better. So besides our nervous systems, and you pretty much put it all together for us, that I think, yes, this is a physiological condition, but what would you say?
So I feel, most conditions will have, have combination of mind, body, spirit. I don't think our nervous system lives in isolation. Our brain is here, our body is over there. What we eat makes, our nerves feel better. If you had too much sugar, you feel all excited and, hyper. If you had too much caffeine, right? So our nervous system is connected to our body, right? The vagus nerves connects to our heart. We'll have a heart break. So to say that fibromyalgia is only nervous system condition. Now, we have to define conditions in some categories, right? For medical, either billing or education or processing or pharmacology, how we're treating conditions, how we're defining them. But our health is not. So if fibromyalgia is a condition of pain processing problem, how your brain is processing pain, and its exaggerated response to pain. So how you feel pain if you have fibromyalgia versus how you don't feel can be measured on the MRI of the brain. So the MRI is of the brain is studying the nervous system. So yes, it is nervous system. But if you have chronic pain, what do you also do? You have increased stress. So you have heart palpitations, you have sweaty palms, you are stress eating or overeating, or or not, you don't want to move. There's lack of motivation, right? So how can you say this is just nervous system condition, just like Parkinson's or migraines? If you have migraine, you're going to be vomiting very often. Well, is vomiting nervous system condition? No, it's a GI condition. You're vomiting from your gut. If you have blurred vision, is it your nervous system or your affect, or your I'm lacking the vision cortex. Again, our body is not in isolation, but our medical system. We go to cardiologists for your heart disease, GI for your GI symptoms, your reflux or your IBS. We go to oncology for your, cancer treatment. Our system is so fragmented. We have a specialist for every body organ, and no wonder fibromyalgia doesn't fit anywhere because no one wants to treat it, right? Because it or doesn't really. I wouldn't say that, but it's difficult to treat because it's not one condition, one organ, one body system. Does it make sense or answer your question?
Yes, it does. I've also heard that fibromyalgia can be an amplifier, and like you said, it can be any system in the body. So that if we have other health conditions going on, that sometimes it can also show up a little more intensely for us than others.
Yeah, it's like a big speaker, right? There's a concept of central sensitization syndrome, and it's a big, circle of different conditions including POTS or postural hypertension, including IBS, which is GI, including fibromyalgia, chronic pain, chronic fatigue syndrome. All those conditions get amplified by a nervous system. Our body does not know it has pain. Your finger or your toe or your belly does not know you have pain. Only your brain does. Your brain tells you, hey, I have a splinter in my, or paper cut, or appendicitis. Different pains will produce different response in our brain and create different alarms, right? If you have a paper cut, paper cuts are not dangerous because when you were 3 and you had a paper cut and you're like stressed out, like, oh my God, I'm gonna bleed to death. I have a paper cut. And then your brain says, this is paper cut, or your mom says, this is paper cut. Let's put a Band-Aid on it. It's not dangerous. So your brain created a story, paper cuts, Band-Aids, mom kisses, not dangerous, right? Our brain creates stories around our pain. Appendicitis, this is why we have peritoneal irritation. It's lights and sirens. We're not going to ignore our appendix, bursting from inflammation. Our body will create that response, go to ER. So we have a story, we have a perception, our brain analyzes inputs, history, how our parents use pain, but our brain creates a story and amplifies our perceptions because of stress and because of our thoughts, right? If we're panicking a lot or thinking a lot, our pain will be worse. Deep breathing. When you have a baby, what do? Take a deep breath before your contraction, your pain will go down. So again, it's not one organ, one condition. Everything gets like a big speaker amplified in fibromyalgia because of that perception of stress and pain.
And many of us here understand that word stress. So I know a lot of us have to work on it. And just, I do like that you mentioned the resilience scale too, in combination of the ACEs as in a comparison, because sometimes out there we just hear of ACEs and it gets confusing. And especially for those of us too that maybe started with chronic pain as a teenager. So we fall within that, but like have been predisposed potentially to a lot of infections. We hear that with kids, like we were always sick, or maybe had severe allergies and growing pains. This is all coming up within a lot of the community discussions for earlier on in age, which falls within that time frame. So I appreciate you sharing the scope because there's a lot of details to that.
Yeah, we see that childhood illnesses, again, triggering going to a doctor, stresses, right? How we process ear infection. Doctors are stressful. They're poking in the ear, they're wearing white coat. Stress is universal, but some people's nervous system may be a little bit more sensitive, maybe because of in utero, maybe because of multi-generational trauma, maybe because of some exposures. So how we deal with stress as adults, but also the resiliency. A lot of people have more ACEs, right? Many ACEs, 4, 5, 6, and they're not living under the bridge homeless. They're successful people. They work, they have families. They're not all alcoholics, or many, they manage their life because of their resiliency. They develop resiliency either through connections with others or self-advocacy, or something that was, again, those scales are wonderful reflection of what is good in our lives, not just what is bad. Because most people are extremely, extremely resilient, especially people who I see with fibromyalgia. That's very common.
Absolutely. And we try to empower people here. That's why your presentation was fantastic, of empowerment. Like, there's hope. We don't have to get stuck in this cycle of this feeling. And it's hard to manage as hypervigilance. And I know I talk to Danielle Patelli all the time about it. And Danielle, did you have a question that you'd like to ask?
Yeah. First of all, thank you so much for your presentation. I just was backstage, like, shaking my head, agreeing with everything you were saying. So I'm definitely afterwards going to go rewatch everything and download it. So thank you so much. I did want to ask, because I know a lot of times when people hear fight or flight, they think, oh, adrenaline, and then you must have energy and everything. And I'm like, no, I definitely don't have energy. So how can you explain to people who don't understand, when you're in like long-term fight or flight, you don't have energy, that adrenaline is not actually there?
So when we have the acute response, again, the adrenaline adrenaline is an acute stress responders. Those are hormones that we have to either fight the tiger or run away, or it's going to be, we don't produce enough for a long, marathon run from the tiger. We're going to be eaten before they will run out before they will either get run away or eaten. So our bodies have acute response to stress, and those are the hormones of acute stress. And we should not really survive a tiger, right? We should either be eaten or escape. It will be minutes of that acuteness. But what we see in our chronic, again, the cortisol is a chronic stress response, and that is very impactful, because we continuously, using up the cortisol. We have a higher levels of cortisol, measurable levels of cortisol in our bodies due to chronic stress, and that wears us out. If somebody says, well, if you have that, if you're running away from a tiger nonstop for many miles, or your tiger lives in your living room, will you feel refreshed and energetic? I mean, you'll be dead, right? You'll be eaten. And so our body is not created to continuously produce those acute hormones that give us energy. But so that's my short explanation of why we all feel tired so often after prolonged stress, and how our sleep is impaired. So if you have a lot of stress and you don't have enough sleep, it contributes to that fatigue. And if you're thinking a lot, if you have hypervigilancy, it uses brain power. We can remember stuff. If your body is circling around looking for tiger nonstop in your living room, how you can remember your stuff or be focused? Again, it wears you out emotionally, but also the ATP in your brain, the energy levels, all the things get wasted extra quickly if you have all the stressors and stimuli.
Yeah, that makes so much sense. Thank you so much. I also wanted to ask, I appreciate you explaining the different types of stressors, and I feel like being able to identify those in your life can probably help you, learn how to treat them, I guess, in a way.
Mitigate them, yes.
Yes. And so I know on your website you have the postcard to be able to download. In my life, I get stressed out when I have to try to explain to someone who does not understand or believe fibromyalgia is real. And I know on your website you have the postcard that people can download, that you have like a little explanation that's, from a doctor, telling
you.
people fibromyalgia is real. So I think that is incredible, and I would love to make sure everyone here can get access to that. So
I think the most or the best comment I hear from the patients I see in my clinic is, finally somebody listened and validated me that I'm not crazy, that it's real, that my suffering is real. Because again, validation is a big deal for patients with fibromyalgia. In knowing that you're not imagining it yourself, because a lot of patients tell me, I thought I was going crazy. I did not know, is it real? Am I just, neurotic or, histrionic? That is not just me. And, in knowing that you have the reasons for your symptoms, that you have, either multi-generational trauma or childhood trauma or something that activates your nervous system in an abnormal way for a reason and creates all these cascades of symptoms, I think is empowering. And again, you're right, you can mitigate a lot of stressors. If you're commuting too much, well, maybe you should find a different job if it's possible, or do telecommuting. If you have a toxic relationship, if your mother-in-law or your mother or somebody close to you are toxic, well, maybe removing them out of your life is a solution, maybe short-term solution until you get your stuff in order. If you're eating toxic foods, well, that also, a stressor. Improve your nutrition. Those things are modifiable, and you can mitigate a lot of stressors. So you're in the driver's seat of your health. And this is my point of the whole presentation. You are in charge, not the doctors or nurses or family. You're in charge of your health. Don't be a victim. Take charge. And there are many, many solutions available for you to improve your health.
Yeah, thank you so much.
Thank you.
Danielle Goodrich, did you have one more question? And I know we'll close it out soon because we want to honor Dr. Pinkston's time as well. She's very busy and she has a lot.
Not a question. I just want to thank Dr. Pinkston for her podcast, Mind Your Fibro. As you said, there's a lot of puzzle pieces that we can do on our own, and that really helped me on my journey to getting my fibro in, I guess, remission, they call it. But I don't have a lot of pain anymore. And a lot of it is because you went over all of that stuff on your podcast, and one by one, very slowly, I just kind of addressed each thing. So I want to thank you for that. Also, I'd like to know what else is in the future for the podcast and for you.
Oh, thank you. So I took a break from the podcast this year. I really had all the intention to spend more time talking about the trauma and the body responses to trauma and mitigation. I had all these plans, but I also was running a membership for a year called a roommate membership. I blocked the name. So I spent a year coaching people on fibromyalgia. We had small group, but mighty group of my guinea pigs, my people I learned with, and it was very helpful for me to see how much I can teach, but also self guidance and self care of patients or people who are coached, how much time they invested in themselves was proportional to their outcome. And not just time and effort, but also money. I can tell you, patients I gave the membership for free, 99.9% did not attend any courses, any classes. They did not listen, and which for me was a little shocking. I thought, well, they're going to jump in. It's free, it's available. The doctor is teaching them, but they didn't invest in themselves. They didn't put their effort. They didn't find it on their own. And the people who did and attended every week, or most weeks, they participated. They had improvement in their life and their pain, and we had a wonderful community. They're now friends, and they feel like family. It was a very short, small group, but it was very, very. To me, it was a powerful experience. But also, it showed me that coaching and psychology is not enough. We have to do all other kind of whole health, mitigation, or it's just in sleep and nutrition and sugar. And so in again, people who use those have better symptom control. People are more consistent, have better symptom control. It's not surprising, right? If you have diabetes, it's the same thing, right? If you eat well, if you take medication, if you exercise, if you lose your weight, you're going to have the greatest control of your diabetes. So fiber is not different. So, So my new plan is I'm actually opening my own practice in January. I'm super excited. It's called Whole Health Rheumatology, appropriately. So I'm hoping to use integrative medicine, functional medicine, conventional rheumatology to address all rheumatologic problems, conditions, as well as fibromyalgia. Unfortunately, in my city, we don't have rheumatologists who treat fibromyalgia the way I do. Again, primary care often understaffed or under educated. Pain management have their own modalities. So I'm looking for, again, this holistic approach to health in general, mitigate the cardiovascular risk factors or diabetes or, all the things that we can modify with nutrition, lifestyle changes, as well as microbiome. I know Melissa can relate to that with the functional medicine, microbiome adjustment, things I learned right now in integrative medicine fellowship, really inspired me to, I need to do it for my patients, for myself, to just have a little bit more, I don't know, my life just felt right to do it at this time.
We are so excited to hear that news, and we definitely are going to be supporting you with links and shares, letting people know how to work with you. And yes, we're all about the microbiome. To tell you a funny story of your colleagues at ACR, this year we got some poop emojis at the table. So they were asking us questions and encouraging people to talk about their bowel movements, which again, we're at a rheumatology conference and sounds bizarre, but there's so much TMI with not sharing with your provider some of the limitations that go on with GI, because we wait for the GI specialist, but there's so much connection all together, as you mentioned, with the whole body. So it's whole health.
Yes. I feel like right now as a rheumatologist, I focus a lot on, biological medications, things that they are very helpful and life altering. If you compare rheumatology patients today versus 40 years ago, we don't see deformities. We don't see, life consequences. We see a few cases of cancer related to autoimmune conditions. So I don't want to negate conventional rheumatology. It is life altering. So I want to build on that. I don't want to replace it. I would always tell patients, this is not either or. Some patients need all the tools we have in conventional medicine. If you have a heart attack, you need a stent. If you diabetes is out of control, you need insulin. But you also need nutrition and stress management and sleep and everything else. So yes, this is kind of what I'm thinking and I hope, if VA is doing it, must be something right, or something in the right direction at least, because I'm hoping that it will take off in all healthcare systems, not just the VA, but overall in the United States.
It is. And to report back to you from ACR conference, we weren't sure about our fibromyalgia booth. Quite honestly, at ACR, we thought the rheumatologists might be running away from us. They embraced us. So we have good news, and we have some people in rheumatology that want to work with fibromyalgia. They understand. So we need to make the connection to you so that we build that community also with providers that are taking more of a whole health approach. So it's exciting. There are people out there.
Yes, I'm hoping to attend the next ACR. I really didn't want to fly all the way to San Diego. It's quite a flight from Kentucky.
But it's beautiful. We missed you. So Washington, D.C., then we'll look for you.
Yes, I'm hoping to be there. Now I have more flexibility because I have my own practice. So I'm excited to have more connections like that.
Yay, that's wonderful. Thank you so much for being here, Dr. Pinkston. We appreciate you. We'll make sure that we update all the links and let people know where they can connect with you online. Podcast, gonna listen. It's evergreen, so you can continue to listen to the podcast. We are going to get ready for our next presenter.
Thank you so much.
Thank you, Dr. Pinkston. We'll be in touch soon. Bye.
Thank you.
Thank you. Okay, so everybody, we're going to get us back in line. We're going to just take a quick short break so that we can get our next presenter up on stage. She is waiting in the green room, so let's bring her back. We're going to take a quick break here. Hello, hello to all the fibromyalgia community. We are getting ready for the next presentation. I lost count on where we are with 10 minutes, so I'm not sure if it's 10 minutes, but definitely come on in here. And we'll bring everybody to the stage in just a second. We'll get back. Why don't we just wait till the top of the hour for the 12 o'clock? So be sure to get some water, do a little bit of stretching, and we will be back here shortly. Hello, hello. We come on back in. We are ready. I'm sure that was shorter than 10 minutes. I apologize. And I know we didn't get a chance to connect yet with Danielle Goodrich, but I did want to say happy belated birthday. We are celebrating her birthday with Danielle. Her birthday was yesterday, but we always celebrate. You get the whole weekend, right? Or the whole month. Is it a whole birthday month for you or a whole weekend?
Oh, usually just the day. Although this year I didn't have
Yay.
to work, so that was great.
Oh, awesome. And you get to be with us. We get to celebrate. I cannot sing because I will scare everyone. So just in the chat, if you're out there, please wish. Ooh, I need to hide. There's some spammer comments. So just to prep everyone, watch out for those spammer comments. They come in from Facebook. Do not click the links, whatever you do. So just avoid them. We'll try to get to them and block them as soon as possible. But please don't click those links. We're noticing that they do come in from Facebook occasionally. They come in responding to certain hashtags, especially fibromyalgia. So we're going to try to take care of those. But just to let people out there know, for your safety reasons, do not click those links. Especially if you are on Facebook. We enabled settings in YouTube so it doesn't happen, but Facebook doesn't have the same settings to set up for us. So unfortunately, so keep an eye out for that. And again, they do not click those links for people out there. Yay, we got happy birthdays coming in. It is a very special that we get to have this with Danielle being here as well. So I look frozen in time. Hopefully not.
You do. Thank you so much.
Okay, well, we'll keep going. And what I want to do is, I think we took the break too fast. Am I still frozen, everybody?
Yes.
Okay. You know what, Danielle, and if you could, let's continue with the break shortly. Michael is backstage. If you could put the break duck on so I can figure it out and take Danielle off the stage. Let's try this again. We're back again. Okay. I think I was trying to do so much, and it doesn't like it when you try to do this. So let's get this started with the presentation while we are here. As I mentioned to everyone, this is live. We are very, very, very live. Okay. So I'm excited to bring up Chloe Jones, a graduate research assistant. So just to let you know, she received her BA in psychology from the University of San Francisco with minors in neuroscience and child and youth studies. In the Neuroinflammation, Pain, and Fatigue Lab, she has served as a project coordinator for neuroimaging studies investigating neuroinflammation in Gulf War illness, fibromyalgia, and MS. Her research interests center on the varied physiologically mechanisms underlying poorly understood pain and fatigue disorders. So let's bring her up to the stage, and she has a special presentation for us as well. Hello, hello.
Hi there. Thank you for introducing me.
We are so excited and thrilled to have you here for this presentation. I know we appreciate you being here live, and going to share with us more. Just to make sure, because I kind of butchered this introduction a little bit with the connection issue, you are streaming from where and what department?
Yeah, so I'm currently live to you from the University of Alabama at Birmingham. And we're in the Neuroinflammation, Pain, and Fatigue Lab, which is housed in the Department of Psychology.
And you work with Dr. Jared Younger, correct?
Yes. So Dr.
Okay.
Jared Younger is the principal investigator of the lab. And so all of the studies that I'm going to be talking about today are performed under the supervision and direction of Dr. Jared Younger, and I'm one of his graduate students.
we are so happy to have you here. So I'm going to get you started. We're going to put your slides on the stage, and Danielle and I are going to disappear backstage for a little bit while you present, and then we'll be back for the Q&A.
Okay, great. Thank you so much. All right. Well, thank you, everybody. Again, really happy to be presenting today, and I'm going to be sharing some of our recent publications on some immune study experiments that we've done in fibromyalgia. And so I'm going to go through a few different topics, but I want to let you know that if you do want to stay updated on our research and our findings, and also be aware of any recruiting studies, we do have a Facebook page. If you look up the Neuroinflammation, Pain, and Fatigue Lab. And Dr. Younger also likes to make YouTube videos about various topics that we might be interested in at that time. So if you want to kind of stay updated with us, that's one way to do it. So for the presentation today, I am going to review 3 different studies that, again, have recently been published from our group. The first study looks at altered immune sensitivity in the body in fibromyalgia. When I say in the body, I mean how we can measure it in the blood. And this word sensitivity is really important here because we're looking not just at kind of general immune markers, but we're really looking at any hypersensitivity of the immune system or exaggerated sensitivity, or in this case, altered sensitivity. So the immune system's responses to maybe triggers in the environment or other internal triggers as well. The second study I'll be talking about looks at immune function in the brain. So we can't really look at brain function in the blood. It's quite hard to measure the brain. We have to use, more indirect measures. And so we've done some brain imaging research to try to look at immune function in the brain in fibromyalgia. And then the last study kind of combines those 2 lines of research. So it looks at immune sensitivity, but in the brain. And so I'll be reviewing these 3, starting, of course, with the first study, this immune sensitivity in the body. And so why would we be interested in immune sensitivity in fibromyalgia? Well, first, one important clue is that we do have this phenomenon of fibromyalgia flares, which we're all familiar with, that we have these fluctuations of symptoms. They might seem like episodes, and they can be pretty dramatic, but you have this increase in symptoms, overall symptom burden worsening. And these symptoms, of course, tend to be, the generalized pain, but also these other symptoms of fatigue and brain fog, cognitive issues, even depressed mood, and even like flu-like symptoms, kind of sickness feeling, right? And so these symptoms and these flares are kind of what we would expect if there was immune system involvement, that you would have these fluctuating courses and that you would have these type of sickness feelings. And so what is called the sickness response is a well-established phenomenon that occurs when the body is, under attack, under infection, under stress. The immune system produces this sickness response that causes these feelings of fatigue, pain, malaise, brain fog, etc. And Roland Stow did this great review on how this sickness response and these inflammatory responses really kind of overlap with fibromyalgia symptoms. And it suggests that there could be some immune involvement there. He also does a great job in this review pointing out, though, that a lot of the studies that have kind of looked at immune markers in fibromyalgia haven't, reliably been significant, that we haven't seen, consistent differences in immune markers in fibromyalgia. And so one potential reason for that is this important distinction between baseline studies and provocation studies. So baseline studies comprise the majority of biomedical human, scientific research, where we might take, in this case, for example, 2 groups. You have a healthy control group and then the illness group, and we compare them at kind of one point in time, see if they vary in any way. Or we even might look at them over the course of multiple days, see if they vary from each other. But provocation studies look at provoking the immune system or kind of causing a stress or a trigger. And that way we can see if the response is different. So not just if they're different at baseline, but if they're different in how they respond to a provocation. So that's why there are these provocation studies. And these are mostly, done in like rodent studies, animal studies, and there are a few groups that do these endotoxin provocation studies, but it never had been done in fibromyalgia. So we decided to do that experiment. And so this was published just this month. This is in the Journal of Brain Behavior and Immunity, and it is open access. So if you would like more details on the study and you want to look at all of the findings, I encourage you to go ahead and download this as well. But this was a provocation study that we did in fibromyalgia, and the provoking trigger in these studies is endotoxin. And so let me tell you a little bit about what that type of study looks like. So this is a pretty big study day for participants. So they come in the morning. We confirm that they're eligible to participate. And then T0 refers to time point 0. We get some baseline measurements before we do type of provocation and provoking of the immune system. And we draw their blood so we can get kind of a good look at them, just how they start out. And then we have this LPS infusion. Now, LPS stands for lipopolysaccharide, and it's really kind of interchangeable with endotoxin. And endotoxin, again, is this trigger. Endotoxin or lipopolysaccharide is expressed on gram-negative bacteria. And so if we infuse it into somebody, it makes your body think that there's a bacterial pathogen present. And so that's how it kind of triggers the immune system into ramping up a little bit in a predictable way. And what's been seen is that even in healthy individuals, right, when you provoke the immune system, you'll experience these symptoms of fatigue, of pain sensitivity, brain fog, malaise, etc. But we wanted to see if individuals with fibromyalgia might be differentially sensitive to immune triggers. They might be overly sensitive, or they might just have a different immune response than expected in the typical healthy developed population. So they receive this endotoxin or LPS infusion, and then their vital signs are monitored consistently throughout the day. And then every hour we took their blood to monitor their immune response, so we could really characterize and describe how healthy controls responded compared to individuals with fibromyalgia. And so this was a smaller pilot study, partially because this is, it's kind of an intensive protocol. It's sort of an all-day thing. And also it's never been done in fibromyalgia before. So we needed to kind of prove that this was worth something to look at. So it's this smaller study. So we had 8 women with fibromyalgia and 8 women as healthy controls. And they attended actually 2 of these study sessions, every participant. The first one was this very low dose of endotoxin, this 0.1 nanograms per kilogram. And then the second session was a slightly higher dose of 0.4 nanograms per kilogram, but this is still a really low dose. Typically, human endotoxin studies, again, although there aren't a lot of them, they tend to be around 0.8. So we wanted to look at these very low and low dosages because this is maybe going to be more reflective of sort of daily immune triggers, daily immune insults. And we also wanted to see that in these very low triggers that maybe even healthy controls are okay with, that maybe there's some increased sensitivity in fibromyalgia. At these hourly blood draws, we were able to look at a lot of different markers. And so I'm not going to be able to review, all of the results today because there's just too many. But some of the ones that were of primary interest were leptin. And leptin is primarily known as being involved in appetite regulation. It's lesser well known to be involved in chronic inflammation and in the innate immune response. And so there has been some research suggesting that leptin might be altered in fibromyalgia. And so we wanted to look at leptin as one of our primary outcomes. And we were also interested in this marker fractalkine. Fractalkine is also not looked at very often, but it's really important in at least what some research has shown, particularly in vitro studies and animal studies have shown that fractalkine is important in attenuating or kind of reducing the inflammatory response. And lastly, we got some kind of broad markers of other inflammatory, cytokines, chemokines. We did look at hormones, and then we also did clinical tests before and after the endotoxin, partially out of patient safety to make sure that everyone's levels looked good before we sent them home, but also to see if there were any changes in complete blood counts and white blood cell counts, for example. Although we didn't really have much expectation for this because there generally have not been consistent, significant findings in clinical blood tests for fibromyalgia. So what did we find? Well, here's one of the primary outcomes, fractalkine. And the very low dose session is in that left panel, and the lower dose session is in the right panel, the slightly higher but still low dose. And as a reminder, individuals received this immune trigger, this endotoxin at time point 1. And it depends on the dosage, but we generally expect to see kind of after around time point 4, the response to start to pick up. And so as you can see clearly, individuals had a response to the endotoxin with a release of fractalkine. But you can also see, and this was a significant group interaction, that there is group differences here. You can see that the healthy individuals released a lot more of this fractalkine in response to endotoxin compared to the fibromyalgia group who had a suppressed or blunted fractalkine response. And again, this is important because fractalkine is important in kind of reducing or attenuating inflammatory responses. One of the other primary outcomes was leptin. And as you can tell, hopefully by the graph, that this shows a much different picture. Interestingly, leptin was already different between groups at the start of the day before we did anything experimentally. So the fibromyalgia group started off with much higher levels of leptin. And now leptin can be affected again by, things like appetite, eating, body mass, etc. And we did some further analysis with that, which is in the full paper if you're interested. But as you can see, there was a difference between groups, and there also was a significant interaction between group and time, meaning that the fibromyalgia group also showed over the day in general an increased release of leptin compared to the healthy individuals who stayed pretty flat throughout the day, as you can see. Again, the healthy being that blue line there. And I'm not going to be able to review all of the cytokines and chemokines and things that we looked at. They were kind of exploratory analyses. We didn't know exactly what we'd find. But I will point out one just to help paint a picture a little bit. This is interferon gamma. And this is important in kind of recruiting other immune cells. So it is considered kind of a pro-inflammatory cytokine. And we also saw a significant group interaction here, but even though it's pro-inflammatory, in this case, we see this suppressed or this reduced response in fibromyalgia compared to the healthy individuals who showed this more expected kind of inflammatory increase. And so I wanted to include this one as well to try to paint the picture that the results from this study were not just across the board elevated immune reaction, that we actually saw more of an altered profile with some reduced responses and some enhanced responses, which suggests that there might be some more complex mechanisms at play here. It also suggests that, fractalkine and leptin warrant further investigation, right? These were ones that we were particularly interested in, and we did see these significant group interactions. And so we think that this should be further pursued, ideally in larger samples. And I hope that overall I've underscored the importance of these kind of provocation style studies. Again, they're not done very often, but it does show that just because something isn't seen at baseline, just because you don't see group differences at baseline, doesn't mean that group differences don't exist, right? As you saw in some of those figures, at the beginning of the day, the groups look the same. It's only after we triggered with the endotoxin that the groups begin to diverge. So that was the first study, which again is looking at immune sensitivity in the body. But we're also really interested in looking at immune function in the brain. The reason for that is because those symptoms and that inflammatory response that I talked about really mimics not just inflammation, but really central inflammation, particularly symptoms of, this hypersensitivity reflects kind of central nervous system, central nervous system dysfunction, as well as, brain fog, cognitive symptoms, generalized malaise, and profound fatigue. All really are what we would expect if there was inflammation occurring in the brain called neuroinflammation, which is something that we really like to study in this lab. And in the brain, we have these resident immune cells called microglia. And microglia, when they're kind of in a more passive state, they're in a calmer state, they look like on the figure in the left pane. And then when they are in an activated state, or when they're kind of triggered, they change their phenotype and they look more like the figure on the right. And when they're triggered, they take on this pro-inflammatory role where they produce these cytokines, they recruit other immune cells, and in general, that results in these feelings of pain, fatigue, sickness, etc. And so there's a few different ways that we can try to look at microglial activation. We can try to look at brain inflammation. One of those ways, one of the best ways, is with PET brain imaging, right? We can't take like a blood draw from brain tissue. We can't, take a slice of brain tissue. We have to look at it indirectly. And so PET brain imaging, or positron emission tomography, does use some radioactivity. And it depends on what you're interested in, depends on what you're looking for. But you get a radioactive tracer injected, and depending on your factor of interest, that tracer will bind to, a specific cell type, for example. And then you can see how that kind of lights up or shows up in the scan. And in this case, we're interested in inflammation. So we want to try to see if we can measure how many of those microglia are activated. And there actually have been a couple studies done in fibromyalgia with PET brain imaging looking at brain inflammation. One is from this group out of Massachusetts, Albrecht et al., 2019, and they used this radioactive tracer, PBR28. And then there was another one, CO et al., 2021, and they used a tracer of PK11195. And both these studies saw that there was evidence of neuroinflammation in fibromyalgia. I'm going to have to get into the weeds a little bit here, but it's really important for the justification of our study. So these two studies, which were, great studies, good findings, these tracers are TSPO ligands, meaning that they bind onto these TSPO receptors. And TSPO is expressed on these activated microglia. So when you have more things binding to TSPO, that gives you a sense that there's more inflammation in the brain. And there's many different ligands that have been developed to try to bind onto TSPO. But creating PET ligands is very complicated, and they differ in their stability and their signal and their half-life, etc. And these tracers that were used in these studies are sometimes controversial because they're considered to have not very specific bindings. So they bind to TSPO, but they also bind to other things. So you don't necessarily know if the results you're looking at are really reflective of what you're trying to look at. They also don't have as good signal to noise ratio, which again decreases your confidence in the findings. So sometimes these tracers are seen as kind of controversial. There have been better tracers developed, these kind of newer generation tracers, and one of them is DPA714. DPA714 has shown to have, compared to these older tracers, have better half-life, better signal, better binding, more specific binding again, so you feel more confident that you're specifically imaging these TSPO receptors on activated microglia. And so we thought it was warranted, especially based on this past research, to try to kind of replicate this fibromyalgia PET brain research with this newer generation ligand. So this paper was also published this year, and this is led by Dr. Muller, who is a former graduate student in the lab. And this is in the Journal of Pain, and this is also, available freely to everybody. So you can also download this paper if you want to learn more about the study details. But this included 15 women with fibromyalgia and 10 healthy women that underwent this DPA brain scan. And then we kind of divide the brain up into 28 different regions. And that way we can kind of interpret the uptake of the signal a little bit better. And this study was funded through the American Fibromyalgia Syndrome Association, as well as some additional support from the National Institute for Neurological Disorders and Stroke, which is also why it is freely available. And what did we see? Well, when we look at those 28 different brain regions, as a reminder, when we see this uptake of DPA, that means there was more binding to TSPO, meaning there were more activated microglia, meaning there was more neuroinflammation. So uptake of DPA means more neuroinflammation is the idea. And in fibromyalgia, we saw higher uptake in right postcentral gyrus, right occipital gray matter, and right temporal gray matter. And these are really all these more kind of posterior cortical areas of the brain. There was also one region that actually showed slightly lower uptake in a more medial region, but it did not survive correction for multiple comparisons. However, what's really, really important with these TSPO studies is that there actually is a big caveat in the analysis, and that is genetic affinity. So everybody varies significantly in basically how well things will bind to their TSPO receptors. And it's just based on this genetic type, this genotype. And so all participants had their blood drawn to assess for their genotype as well. And anyone who had what's considered a low affinity genotype, so they would have very low binding, were excluded from the study because they will have very little signature. Not because of any illness or disease, but simply just because of that genotype. It really confounds the study results. And so in order to account for this, a genetic affinity was included as a covariate in those analyses I just shared. But Dr. Muller also did some further analyses looking at just those who had the same genotype of this high affinity. So rather than having people vary within each group quite a bit, all of these individuals had the same genotype for this TSPO binding. And in this new analysis, we saw similar regions, but more regions also significantly different between groups. Fibromyalgia showed higher uptake in the left and right precuneus, left and right postcentral gyrus, as well as the left and right parietal gray matter, left and right occipital gray matter, and left and right supramarginal gyrus. And if you're not familiar, with brain anatomy, don't worry about it. But again, this is looking at kind of posterior cortical regions, including one more kind of medial region as well. And these results do kind of corroborate with past imaging findings in fibromyalgia, kind of seeing similar areas pop up here again. And it's important because a lot of these areas are involved in kind of pain processing, sensory processing, etc. And these findings are also done in a different way as well. So kind of, approaching this from multiple analysis angles. One other way that brain imaging is conducted is also through voxel-based analysis. And basically this means that we're looking in finer detail and small grain detail. Rather than those 28 brain regions, we look at these very tiny voxels, which are, you could think of like pixels in the brain. And there were 3 kind of clusters of voxels that were significantly different particularly right precuneus, right inferior temporal gray matter, and right inferior occipital gray matter. And those are imaged in the figure to the right. And those little red dots in the middle of those clusters, that's sort of maybe the particular voxel that was sort of the most significant in that white cluster. But again, it's kind of a different analytic approach than the brain regions. But again, we're seeing an overlap in this kind of more posterior cortical matter. So what's also important is to see whether or not the amount of neuroinflammation that we see, or the amount of uptake that we see in this brain scan, is also related to the severity of illness. Because it's one thing to show that it's different between groups, but if you can show that it's also related more directly to, the symptoms, then that also suggests that there's a closer relation present. And so this analysis was done on just those with the high affinity genotype, and it was looking at the most significant brain region that was different between groups, which was parietal gray matter. And so in this brain region, and among these people with this high affinity, there were several correlations between symptoms and the amount of uptake, or the amount of neuroinflammation. So they had several questionnaires administered, the brief pain inventory, the short form 36 for functioning, an anxiety depression screener, as well as a cognitive symptom screener. And higher uptake was associated with worse quality of life, worse energy, worse pain, increased pain interference into life, increased symptoms of anxiety. And I wrote decreased visual memory symptoms there, but it should be increased as worse visual memory symptoms. And so in general, this shows that, again, kind of worse symptoms were associated with more signal in that area. And I want to talk just very briefly about how neuroinflammation connects to fibromyalgia. So I kind of discussed how neuroinflammation in the brain would kind of mimic some symptoms that we see in fibromyalgia, but it also might have kind of more specific relationship to pain sensitivity through the process of central sensitization. If any of you are familiar with that theory, if there is a process of inflammation occurring, this can cause hyperexcitability of neuron signaling, of neuron firing. And that means that pain signals that might not otherwise have been transferred along do indeed fire. So this figure on the right is a little bit complicated, and you could ignore most of it, but it just shows this is at a neuronal synapse, that these neuroinflammatory glial cells and the release of their chemokines and cytokines interact at the synapse and make it more likely for those neurons to fire. And those neurons, again, transmit pain signals. So essentially, neuroinflammation through central sensitization could lead to increased pain and increased pain sensitivity. Additionally, it might depend on also where we see that inflammation in the brain. So again, brain areas that are involved in sensory processing, spatial awareness, attention, and perception are what we've found in this study. And it makes sense that inflammation in these areas and hyperexcitability and increased firing in those areas might result in increased pain and pain sensitivity. So that is our second study of looking at altered immune function in the brain with PET brain imaging. So next, I want to talk about our third study, which again kind of brings those two studies together. This is looking at kind of altered immune sensitivity in the brain. So this paper was also recently published earlier this year, again led by Dr. Muller. This is abnormal immune system response in the brain of women with fibromyalgia. And this is also open access. If anyone wants to, find this article, feel free to download it. And this was also supported through the American Fibromyalgia Syndrome Association. So for this study, we had 12 women with fibromyalgia and 13 healthy controls. Again, this is sort of a smaller study because, again, we're doing this endotoxin challenge paradigm that I talked about in the first study. But this time, we're adding in brain imaging. So now we can look at the brain's response before and after endotoxin. And in this case, the endotoxin dosage was a little bit higher. So we had that 0.4 nanograms per kilogram again, because we saw that based on our first study, people were able to tolerate it and we saw kind of good results there. But actually in this study, there were a few participants who had negative side effects that were negative enough that we decided to decrease the dosage. Now, some negative side effects are expected, right? We're triggering the immune system, so we expect you to not feel your best, after that. And of course, participants are informed of that. But some participants felt not only kind of bad, but they felt bad enough that they didn't want to continue with the rest of the study, and we certainly don't want people to be experiencing that. And so they were able to, discontinue the study. We monitored them to make sure that they would be safe to go home. And then we followed up with them, over the next days and the next weeks. But because of that, we decided to decrease the dosage by about 25% for the rest of the study, which appeared to be a good move because we didn't have to reduce it any further. And then again, we have these brain scans before and after that immune provocation, that immune trigger. But these brain scans are different than the brain scans that I was just describing. So before I was talking about that positron emission tomography, those PET scans. These are magnetic resonance spectroscopy scans, and they're done with an MRI machine. So there's no radioactivity, no radiation, no injections, no contrast agent, nothing like that, just the big MRI magnet. And an important reason for that is because we can't really do that PET DPA study I was talking about. You can't really do that multiple times in the same day. It's just not feasible and hasn't been looked at well enough to see if that would even really work. So especially because some of that kind of remains in your system for a while. And so you wouldn't really have two clear separate scans. So we had to instead use the spectroscopy scans. And with spectroscopy, you can get some indirect measures of neuroinflammation. So it's not as close or direct of a marker as that PET brain imaging, but there are several things that we can look at that might clue us into neuroinflammation occurring. One being brain temperature, which we can measure by the way that water reacts in the brain. And so we can get a kind of proxy of brain temperature with, of course, increased temperature being reflective of inflammation. So the same way that your body, raises temperature, your brain does too, but it's more consequential when your brain has temperature changes. And so usually there are mechanisms that our bodies utilize to prevent the brain from heating up too much in inflammation. But so temperature of the brain is important. So that's one of the things that we can look at with this type of scan. Another thing to look at is choline, these metabolites, this choline, myoinositol, and N-acetyl aspartate. Basically, you'll see either kind of increases or decreases of these metabolites in a state of inflammation, reflective of more cell turnover, reflective of, cell integrity, that sort of thing. And so the findings from this study, again, there's many analyses in this case because, we have all these different brain regions, we have all these different markers, we have the before scans and after and other interactions. And in general, people did show responses in the brain to endotoxin. And in general, they showed differences depending on the dosage that they received. And that was pretty robust across all participants, healthier fibromyalgia as expected. But what we're really interested in to see if there's any differences in the response, looking at those group differences, right? And there weren't as many of those. But one of the most significant was brain temperature increasing in the right thalamus in only the fibromyalgia group. So the fibromyalgia group is this dark black line in this graph, and the degrees are in Celsius, but essentially it equates to about a 1 degree Fahrenheit change before and after in this brain region. And as you can see, the healthy group, in which in this figure is the dotted line, was more stable before and after this endotoxin trigger. And of note, what's important to note here is also that most people did have some increase in their body temperature after receiving endotoxin. But as I mentioned, the body tries to kind of compensate and prevent brain temperature from rising too much. And 1 degree of temperature is not a whole lot. any degree in the brain is important, but we also know that the brain temperature varies somewhat throughout the day. So this is a finding that I would say this should probably be taken with a grain of salt. It's interesting and it's exploratory, but it's not really, very resounding. But why might the thalamus and inflammation in the thalamus might be important? Well, the thalamus in the brain is really important for relaying sensory signals, motor signals, and we have also seen this same finding of increased temperature in the thalamus in chronic fatigue syndrome. Additionally, another paper has looked at volume in the thalamus, and they found that decreased volume is associated with worse fatigue and fibromyalgia. And so there are some findings suggesting that, again, potentially some dysfunction in this region might be related to, seems like specifically fatigue and pain. One of the other more significant findings in this study was a decrease of N-acetyl aspartate in a brain area called the left Rolandic operculum, which is not a very commonly talked about brain area. But essentially a decrease in N-acetyl aspartate is traditionally thought to be associated with a loss of neuronal integrity. So when neurons are injured or they're dying off, then you'll see an increase in this you'll see a decrease in this N-acetyl aspartate. And so we did see that decrease was only occurring in the fibromyalgia group after having received endotoxin. And this area is also involved in some sensation processing, but kind of visceral sensation processing, which refers to, kind of sensation of more, internal sensation, kind of internal organs, as well as it has some involvement in emotion processing as well, both of which are important for our perception of pain. However, there's some grains of salt to be taken with this finding as well, which is that usually when we think about N-acetyl aspartate decreasing, we think about that in a more chronic way and kind of chronic inflammation. We don't expect it to kind of change acutely, kind of over the course of a day significantly. And so it's hard to know exactly what a decrease in N-acetyl aspartate is actually representing in this case. And secondly, you can see there are some baseline differences here. And statistically, baseline differences are also going to impact kind of the interactional differences that we see. And again, this is a brain area that's not super well studied. And so for those reasons, it's another kind of finding that's interesting, but one that is not, again, very resounding. And some of the additional limitations of this study, one is that, with these smaller sample sizes, individual variability is going to have a bigger impact on the results. Exactly in how people are responding to the endotoxin and the brain scans, for example. And then what's interesting is we also had this kind of dropout rate in some of the fibromyalgia participants who had a negative reaction. And so for that reason, the results also might be a little skewed toward those who had more mild reactions. So those who actually might have shown the most robust findings in the brain couldn't complete the study. So we don't have that data, right? So we don't know if they did, but since they had worse reactions, it's feasible to assume that they might have shown more exaggerated results. And lastly, we're using the spectroscopy. We're really kind of using these more indirect measures. And so it's not as direct as like that PET imaging that I was discussing. All right, so those are the 3 studies. Again, we have that kind of immune trigger used, for which we use endotoxin to trigger the immune system. We have that brain PET study, and then we kind of had that spectroscopy brain study with the endotoxin immune trigger. And hopefully, all of these studies help to progress the research and kind of treatment targets and looking at, okay, well, if we see that there's evidence of neuroinflammation in the brain, well, then we have direct target to try to treat that inflammation. So we would need to look at, treatments that can cross the blood-brain barrier and sort of attenuate inflammation on those microglial cells. It also suggests that we need to further investigate the role of fractalkine and leptin in fibromyalgia, that this continues to be an interesting area of promise. And lastly, again, these were these smaller studies. We need to kind of replicate and confirm these altered immune profiles that we observe. And we actually should be able to replicate and confirm our first study pretty soon when those results are analyzed. And lastly, we can then take even a step further and say, okay, we see immune sensitivity, we see neuroinflammation. What is causing that, right? And that'll require additional research as well. But I hope that these studies, help point us kind of in those directions. So thank you very much for your attention, and thank you so much to our, study sponsors, and very much to Melissa for inviting me to speak today. And I'm very happy to take any questions.
We are so happy to have you. I'm trying to contain my excitement too, and I know Danielle, we were behind the scenes as well. We just always look forward to hearing all of this research. I know our fibromyalgia community loves it. We embrace it because we know that we need it for different reasons, especially with having conversations with our clinicians when there's a dismissal that there's nothing going on. So this is great for those tools. And I know that Danielle has some questions for you too. So I'm going to let her take the lead as my co-host today.
Absolutely.
Hi, Chloe. Oh, awesome presentation. Like, there was so much information in there. I guess what I want to ask first is what, sorry, a little brain fog going on there. My brain is going a mile a minute and my mouth can't keep up. But how feasible, you mentioned that 2 of the studies were done with PET scans and one was done with the MRSI spectroscopy.
Correct. Yeah.
And I guess I just wanted to ask how these are not techniques that we can currently see in our doctor's offices, right? These are something that is purely for research and seeing what pops up.
Right. So many medical centers, of course, have both PET and MRI scanners, but the kind of exact tools that we use on those scanners, the ones that I discussed, are usually used kind of in the research domain. So one thing that Dr. Younger has been working on, also in chronic fatigue syndrome and Gulf War illness, is trying to show that this MRSI technique could be feasible in a clinical setting. And so that is part of kind of our ongoing research, and it is feasible because it's doesn't take that long. You don't need any injections. You just need access to a 3T MRI scanner, which most places have, and trying to show that it is reliable has also been the effort of several groups as well. So that's something that we are thinking about. We are working on. And then when it comes to the PET brain imaging, so PET brain imaging is indicated clinically, right, for certain illnesses, certain neurodegenerative illnesses. This particular tracer, this DPA tracer, not as frequently used clinically, right? So some of these newer generation ones are still have to be kind of demonstrated in the research sphere, first before they're widely translated clinically. But with PET, there is significantly more burden because there is that radioactivity involved. So you wouldn't want to do this, multiple times as sort of a clinical check-in necessarily, right? So it actually also might be more important in research studies than it would be clinically, because if we can show that, hey, this illness reliably shows this pattern, and then we can, have some treatment targets, then you can maybe trial those treatments without even having to do the brain scan itself, right? Because when you have radiation, there's sort of a cost-benefit analysis there.
Yes, that would be awesome.
I mean, there's so many questions to keep asking you, as well as what we can do, but I know that we want to honor your time for being here. And we'll alternate with Danielle too. Feel free to interrupt me because my brain is going. I mean, welcome Chloe to the nerd herd over here. A lot of us talk about science, we embrace it, and we love sharing when it comes to especially brain research. how can we as patients be more involved or to support this research moving forward? I know in the past we may have had jokes with Dr. Younger about driving busloads of patients over to you, but that may not be the exact solution. So how can we best support this type of research?
Well, that's a great question, and I'm glad you guys, are excited about research and want to participate. So first of all, yes, of course, participating in research studies is great. And our lab is also trying to move towards more kind of nationwide trials that allow more people to participate, if they like. But another way to help out is also just through your advocacy and communication. So kind of patient-led research is really important to me. I mean, I study fibromyalgia because I've been taking care of my mom since I was 4 who had severe fibromyalgia. And that kind of patient experience is really critical in developing hypotheses, right? It's just the scientific process, right, where you start with observation to develop hypotheses. And then also having patients at every stage of research say, hey, this type of protocol is not going to work for these types of patients, or to say that I've really noticed that this treatment has helped me a lot. Is this something that you want to look into? So these sort of, advocacy groups and organizations do play a really big role in the development of research and really helping us to kind of prioritize what the roadmap should be moving forward.
Ooh, we love it and we'll support it and want to be able to contribute to it. I know we have some questions in here too about just the neurological component. Is that what we are sort of feel like we're moving towards when it comes to fibromyalgia?
That's a good question. It'll depend on who you ask. So of course there's some bias here because we study neuroinflammation, right? So we think that it's important. But there are a lot of other research groups who take, other approaches. But it seems like with a lot of these more idiopathic pain and fatigue illnesses that most likely there's multi-system dysfunction involved. That is probably the best answer. And so actually kind of being able to incorporate multiple of these kind of lines of research is probably what's going to be closer to reality, or like what's really happening, in my opinion. But of course, again, I do have this bias towards kind of neurological research. And that's what I know best.
Well, you can see my bias behind me too. So I think I'm in line with all of this as well with the neuroinflammation brain research, because we are trying to work on getting more. We've done advocacy at the Hill. Danielle's joined us. So we are trying to get our congressional representatives to include line items that will boost funding for fibromyalgia research. So that is something we would look forward to working on with you in the future as well. Before we leave, any last questions, Danielle, because I know that there's so many for us.
Oh my goodness. Nothing that I can think of at the moment, but thank you so much. It was very informative to see what research you've got and where we're headed.
Absolutely. And thank you so much for inviting me to speak. And I'm happy to answer any questions in the chat. Is that okay if I directly kind of respond to some questions? Is that?
Absolutely. Questions will be asked. And of course, all of this content will stay recorded. And then what we do is we break up the content individually and we'll add it to social media as well. So we'll be getting a lot of viewers and potential questions moving forward. We will include links. I know you mentioned some research studies as well. People are asking, what's the best place to go find that research information?
That's a great question. So actually, I mean, clinicaltrials.gov is a great place to start, for taking a broad look at things. Again, for our studies in particular, especially we have some, survey things that people can do anywhere. Like our Facebook group is a good way to kind of stay involved. So those are probably my top 2 recommendations.
Okay, we'll definitely have them to follow everybody on Facebook, the account there, and we see all the updates. We see all the videos. Subscribe to the YouTube channel too. There is a YouTube channel. Hopefully we'll see more of you. Are we going to see more of you on the YouTube channel with Dr. Younger in the future?
Oh, that's a great question. I mean, maybe.
I don't want to put pressure on the system here.
Yeah, maybe if he asked me to say something, I'm happy to. but yeah, those are good ways to kind of stay involved with what we're doing. And we do kind of, we have kind of usually these smaller experimental studies that are more local, but we also do these, more nationwide or global studies as well. So either way, people can check us out.
That's fantastic. And I mean, we do encourage more of the conversation. So if that is something, I know, again, we don't want to put too much pressure on the team, but if that is something that you guys are considering in the future on whether people would listen, we will definitely listen and subscribe and share all that video content and tune in. So
wonderful. Thank you.
Thank you so much for your time again. We'll have to bring you back in 2024 to give us updates. Maybe we'll do some pre-recording so it's not as intense with all the live streaming, but thank you for being here with us.
Absolutely. Thank you so much.
Bye. Okay, so we are still live streaming here, and Danielle, I wanted to just say hello. I know that are you parting ways with us today for a little bit?
I think I can stay on. I'm doing okay so far. So
okay. This is tough with everybody. I just want to give a shout out to everybody here with our co-host. This is a lot. We are really live. We are very much live and encountering anything that can go on with the internet. And so we are sitting here live as fibromyalgia patients too, with chronic illness conditions, trying to stay hydrated, do the things. And once again, I have not factored in some breaks, like we need to have breaks. But it's just, we get so excited with all the speakers and the content here. And then our sort of nervous system keeps running right from the beginning. But I'm excited to bring on, I see our next guest is backstage. And if she can give me a thumbs up, because I can see her, if you're ready to come on stage, everything is set up with your presentation. I'm excited. I always get excited when the naturopathic doctors show up too, because it's a lot of great information here. And she has a fun podcast. Gonna have a great time to bring it here. What I'm gonna do, I'm gonna bring her on, and then she can give an introduction about herself before we get into the presentation. So are you ready, Danielle, for this?
Oh yes, I'm ready.
I know that there's going to be a sense of humor component. So Dr. Adriane, you're going to have to help me. Humor is lower on the scale for me. So bringing out that joy and component will be a lot of fun. So let's bring her on to the stage. Hello.
Welcome.
Welcome.
Hello, everyone. Thank you so much for having me today.
I know I'm going to move you to the center of the screen to welcome you on. We're moving fast in this live programming. And I know we're 3 minutes early, which is actually fantastic.
Yeah, nice job. That's impressive.
I'm glad you're joining with us. Why don't you share a little bit about your background for all the fibromyalgia, our friends tuning in?
Okay. My name is Dr. Adriane Knorr. Hello. I am a naturopathic doctor in Portland, Oregon. I just graduated from medical school this past June, so I'm a new doctor. I have a bunch of experience prior to school, though. I was a birth doula before that, and I'm also, as Mel said, the host of the Sassy Speculum podcast. So I've done my fair share of word vomiting, kind of, which I guess I'm also kind of going to do today. So get ready. I guess that's my background. I don't know. Yeah, that's me.
We will definitely include links for everyone tuning in so that you can follow the podcast. I know it's fun to hear the podcast and you add a sense of humor, empowerment. You also, I'm getting a sense there is some nerdiness in you as well.
Oh, absolutely. Yeah.
Okay, so everybody's welcome to join the nerd community over here. We have a lot of fun. We embrace science quite a bit. We support women in science all the way too. So we enjoy that, and you bring that into your podcast as well.
Yes. Oh, go ahead.
No, go for it.
I was just going to say there's going to be a lot of nerdy, sciencey stuff today as well. So buckle up for that.
Okay. Well, we have our enthusiasts doing all the co-hosting today with Danielle as well. So her background, she keeps me in check. She's helping me study for my microbiology exam so all of you can keep me on track. But let's get started with the presentation. I'm going to add it to the stage. And what is going to happen here is Danielle and myself are going to disappear backstage, but we're still there if you need anything.
Okay.
And then we will have you start our presentation. And for all our fibromyalgia friends out there, keep posting, keep sharing this content, spread it around the internet so people know that there are ways to learn about information. There's research out there, there's providers out there. We're providing up-to-date education. And also, and most importantly, always know that you are not alone in this community. So I'm going to let the presentation begin.
Awesome. Thank you so much, Mel. Also, I forgot to mention that a lot of my background will come up in the next slide when I introduce myself on there as well. So you'll get it again. So hello, everyone. Welcome to Connecting the Dots, exploring the hormonal dynamics in fibromyalgia. As we all know, fibro is a full body disorder that can be categorized into so many different subsections, but throughout this talk, we'll dive specifically into the hormonal subsection of fibromyalgia and how interconnected our hormones are to every aspect of our well-being. And first things first, who am I? I'm a naturopathic doctor in Portland, Oregon. As I said, I recently graduated from the National University of Natural Medicine here in Portland. I have a bachelor's of science in philosophy and exercise and sport science from the University of Oregon and Oregon State, respectively. I'm currently working as a naturopath at One Space Healthcare, where I specialize in women's GI and hormone health, making today's topic right up my alley. As a naturopath, I really focus on empowering my patients with a thorough understanding of their own bodies, and I believe that this is very integral to our healing process. Beyond my medical practice, I host a women's health podcast, the Sassy Speculum, where I work to demystify complex health topics, ensuring that no one needs a medical degree to understand how and why their body functions the way that it does. I truly believe in the power of education and the importance of making medicine comprehensible to a wider audience. That's why I'm here today. And last but not least, I have no conflicts of interest. So let's start with just a generalized overview of the role that hormones play in fibromyalgia. This is a first stop, like, why should I care about hormones in fibro? We are all tired of hearing that we don't really know the exact cause of fibromyalgia. We know that it's not a one-stop shop kind of disorder. It's a disorder that really highlights the interplay between different systems of the body, and the holistic approach is necessary to fully understand fibro in and of itself. In addition to the widespread musculoskeletal pain, other systemic fibro symptoms are listed in this photo and also can include fatigue, orthostatic hypotension, which means getting dizzy when going from sitting to standing, or when standing for prolonged periods of time, gastrointestinal complaints, brain fog, disrupted sleep, and much more. All of these symptoms directly equate to the symptoms of a hormonal imbalance, specifically a hormonal imbalance of the adrenal hormone axis. Further along this train of thought, individuals with fibromyalgia have an increased sensitivity to painful stimuli, which is thought to be due to alterations in our central nervous system's ability to process pain. Now, you may be wondering, what the heck does our ability to process pain have to do with hormones, and how the heck is this along the same lines as an adrenal hormone imbalance? The answer is everything, actually. Our ability to process pain comes from our sympathetic nervous system, most commonly known as our fight or flight response. This branch of the nervous system is governed by the release of two hormones, norepinephrine and epinephrine, which come from our adrenal glands. So our ability to process pain is actually a hormonal response at its core. Of course, there are other aspects that change our ability to process pain, but at its core, pain is a hormonal response. Our sympathetic nervous system, or SNS for short, as I said, most commonly referred to as our fight or flight response. It is one of a two-prong stress response system. It's an innate system. All of these processes are autonomic, meaning that we don't have any conscious means of controlling them. When our SNS is activated during a time of stress, our primal brain is preparing the body to survive something akin to a bear attack. Should we run or should we fight the bear? This is the Sophie's choice that our brain has every single time the SNS is activated, because that's its job, to keep us alive. Our pupils dilate in order to bring in more light, our airways get bigger to allow more air into our lungs, heart rate increases, and blood flow is shunted away from the quote-unquote unessential organs in order to get more blood to our heart, lungs, brains, and muscles, to once again either fight or flee that bear. One of those unessential organs that loses a lot of blood flow is our GI tract. This is one reason why many people report a cottony mouth feeling from saliva drying up, or butterflies in their stomach, or the feeling of food turning into lead when they're acutely stressed. Our gastrointestinal tract isn't imperative to surviving the oncoming bear, so digestion becomes much lower on the priority list. Many fibromyalgia patients will say that their symptoms started after a significantly prolonged period of physical, mental, or emotional stress. Research agrees with this, that ongoing exposure to stressors is much more strongly associated with fibromyalgia and chronic pain in general than a singular traumatic event. That's not to say, of course, that a singular traumatic event can't be the straw that breaks the camel's back, because it totally can. But in general, prolonged stress of any type is often something specific that patients can relate their symptoms back to. But the question that I'm sure all fibro patients have asked is, why? That moves us to the second prong of our two-pronged stress response system, the HPA axis. This is a negative feedback loop between three different areas of the body: the hypothalamus, pituitary, and adrenal glands. These three systems are always talking, always interconnected, but when stressed, the system releases cortisol, norepinephrine, and epinephrine from our adrenal glands. These are the three main hormones involved in a stress response, two of which were aforementioned as being released with the activation of the sympathetic nervous system. And this is accurate. Both prongs of the stress response system work in conjunction to create the fight or flight response that we've all experienced. So the HPA axis feedback loop is simply a bidirectional information highway between different parts of our brain and the adrenal glands. The hypothalamus, a region of our brain that's main job is to maintain our body's status quo through direct influence on our SNS and release of hormones. When the hypothalamus directs a stressor, it releases a hormone that goes directly into the pituitary gland. The pituitary gland is the only region of our brain that has access to our bloodstream. So when the hypothalamus releases a hormone, that hormone doesn't immediately go into our bloodstream to affect other aspects of our body. That hormone is only available to the brain. It goes directly to the pituitary gland, whose main job is to regulate all of our vital and essential bodily functions, as well as general well-being. Because the pituitary gland maintains the control of being the only access point from the brain to the bloodstream, it controls pretty much all other hormone-secreting glands. In this case, we're talking about the adrenals, but the pituitary also controls the hormones released by our thyroid, kidneys, ovaries, and testes, to name a few. After the pituitary releases the ACTH hormone, this goes to our adrenals to inform them of our need to make more cortisol, epinephrine, and norepinephrine. So we've talked about epinephrine and norepinephrine and the traditional fight or flight bodily responses that they create when released from the adrenal glands, but we haven't talked much yet about cortisol. Cortisol is an incredibly busy hormone. It has multiple functions beyond just our acute stress response. It regulates our metabolism by controlling the use of fats, proteins, and carbs. It suppresses inflammation, regulates blood pressure, increases blood sugar, influences bone formation, and even governs our sleep-wake cycle. When it's released during an acute stressor, it provides an energy boost in order to keep us alive when we choose to fight or flee that bear. We've probably all heard the stories of people performing superhero feats, like a mother lifting a train car off of her infant. This is from that cortisol, also known as adrenaline, energy boost. As you can see, cortisol, and therefore stress, don't exist in a vacuum. Experiencing stress doesn't just affect your mood and energy, it also affects your gut and your entire GI tract, your thyroid, your metabolism, your sleep, or lack thereof, your basic ability to break down, absorb, and eliminate nutrients and toxins, and finally, it also affects your reproductive organs. Stress actually has its little grubby fingers in nearly every organ system within the body. So you can imagine if you're under chronic or prolonged stress, that this is going to have an effect on every single system in your body. When we have a healthy amount of stress in our lives, cortisol acts as an incredibly potent anti-inflammatory hormone. We experience an acute stressor like our car breaking down on the freeway or being under a tight deadline at work, and our stress hormones increase. Then, once we've gotten through the issue, our cortisol and epinephrine go back down to baseline. However, when we're under chronic stress, we get multiple disturbances in that HPA axis feedback loop. The chronic stress leads to chronic circulating cortisol. This cortisol feeds back into the communication highway to our hypothalamus and pituitary gland, which suppresses the formation of the precursor hormones CRH and ACTH. When this happens, the body can swing one of two ways: either continuously produce too much cortisol, which then causes a receptor blunting effect, reducing the effectiveness of cortisol, or the suppression of those precursor hormones can lead to a complete disruption in the production of cortisol, leading to a sharp decline in its production. Fibromyalgia is most commonly associated with a deficiency of cortisol due to reduced production or depletion at one or multiple levels of that HPA axis. Either way, with chronic stress, there is an apparent failure in the HPA regulatory axis feedback loop, causing a change in the manners in which we utilize all of our hormones. This is HPA axis dysregulation. The cortisol is no longer producing its anti-inflammatory effects, and it's no longer able to control inflammation at all, which leads to further HPA axis dysregulation. Take a look at the symptoms of HPA axis dysregulation. It looks pretty similar to the symptoms of fibromyalgia, doesn't it? I highlighted the most common fibro symptoms, but in all honesty, I probably could have highlighted all of them because all of these symptoms can and do occur in fibromyalgia. This is because fibromyalgia is an HPA axis dysregulation disorder. Even if your fibro didn't start out with a bout of prolonged stress, the physical and emotional demands that we all know of having fibromyalgia and chronic disease causes that same chronic stress pattern, leading to dysregulation in the production of hormones associated with the HPA axis. Basically, all humans with fibromyalgia would benefit from HPA axis re-regulation. You would think that with the amount of everyday stressors all humans experience, that we would have evolved out of this pattern by now. But unfortunately, evolution takes way longer than we'd like, and our hormonal axis regulation abilities still equate to our more primitive ancestors. We now know that the HPA dysregulation can contribute to multiple problems in multiple organ systems. The hypothalamus and pituitary are so central in governing many of our hormonal cascades. If there's an imbalance anywhere in that HPA axis, this could easily disrupt other hormonal axes. As you can tell by this picture, the hypothalamus and pituitary up at the top send out hormones to our muscles, ovaries, thyroid, in addition to our adrenal glands. So an imbalance of the HPA axis, in essence, means an overall mess of hormones, further exacerbating the previously mentioned problems, as well as adding to others. We're not going to get too caught up in the details here with the HPO axis now, but I wanted to demonstrate before moving into the sex hormones that this hormonal axis all starts with the hypothalamus and pituitary. Because everything relies on those two parts of the brain, you can see how a dysregulation anywhere in that bidirectional pathway of the HPA axis would interfere with multiple different hormone pathways. The HPO axis is in charge of regulating reproductive health and our reproductive hormones, which include estrogen and its metabolites, progesterone, and testosterone. Many have suggested that the major gender gap in the incidence of fibromyalgia is due to sex hormones, which makes sense. Women have much less testosterone, much more estrogen than men. In fact, most testosterone that women produce is actually quickly turned into estrogen and utilized as such. Also, the fact that the gender gap only appears when girls reach puberty strongly suggests that there is some sort of sex hormone involvement with fibromyalgia. The question is it the hormones themselves, or is it the quantity of the hormone in relation to others? As I mentioned earlier, no hormone exists in a vacuum. If one hormone is out of whack, there's another somewhere in the body that's compensating for that imbalance. And because of our menstrual cycles, women's hormones fluctuate every single day. If a man came to me and asked what I thought his testosterone levels were that day, I could probably guess fairly accurately knowing his age. But for women, all of our hormones fluctuate every day. So without knowing exactly where she was in her menstrual cycle, her health patterns, her age, what she's been through in her life, I couldn't even make a rough guess of what her hormone levels might look like. Many studies have failed to show a direct link between estrogen levels and pain tolerance, which is interesting because estrogen usually takes the spotlight in discussions about fibromyalgia and hormones. I'm going to challenge this, though, by going back to the question that I postulated earlier. Is it the hormones itself, or is it the quantity of the hormone in comparison to others? Estrogen and progesterone exist in a very tightly regulated ratio. When one is high, the other is low, except when it comes to menopause, and both drop off. Fibromyalgia in young women is often linked to estrogen dominance, meaning estrogen is dominating over that buddy, progesterone. Higher progesterone levels have been very closely tied to the improvement of fibromyalgia pain, which makes sense as progesterone is anti-inflammatory and modulates nervous system activity while also serving as a neuroprotectant. If progesterone is being dominated by estrogen, it cannot exert those anti-inflammatory effects or help the nervous system to regulate its pain response. Estrogen, on the other hand, is extremely pro-inflammatory. When we have estrogen dominance, this increases our overall estrogen load, causing tissue damage and further promotion of pro-inflammatory mediators released at the site of inflammation. In fibromyalgia, the site of inflammation can be widespread throughout the body, meaning the whole body can become inflamed. Estrogen dominance is a very clear example of a HPA and HPO axis dysregulation. Because estrogen is made in both the ovaries and the adrenal glands, it's impossible to know which one is causing the problem, and the answer is probably both. High estrogen also has been associated with low cortisol, once again furthering the proof that no hormone exists in a vacuum, and fibromyalgia is a hormone-mediated condition. Regulate the hormones, and then you can regulate the symptoms. Interestingly enough, on the flip side of estrogen dominance is menopause. The opposite kind of estrogen dominance. It's the dropping off or decline of estrogen and progesterone. And many women with fibromyalgia have reported that symptoms get worse with menopause. The hormonal fluctuations during menopause create a scenario where the body is adjusting to a new hormonal baseline. This adjustment period can lead to increased stress on the HPA axis, potentially contributing to a dysregulation in the production of cortisol. As cortisol levels fluctuate or become dysregulated, that delicate balance in our stress response is further disrupted. This can manifest as increased sensitivity to pain, heightened fatigue, and challenges in regulating sleep, all hallmark symptoms of fibromyalgia. These two separate aspects prove that it's not so much the hormone itself that's the problem, but it's the quantity of the hormone, and most importantly, in relationship to those around it. Nothing exists in a vacuum. Hormones interplay with each other, and going back to our HPA and HPO axes, if one aspect of that axis is unbalanced or dysregulated, it will have both upstream and downstream effects. Moving on to the balancing act of progesterone and testosterone. While there hasn't been much evidence surrounding specific pain levels with estrogen, there has been quite a bit of research done on progesterone and testosterone. As mentioned before, progesterone is neuroprotective and anti-inflammatory, influencing our pain perception and contributing to our overall well-being. Think of progesterone as the Xanax of the hormone family. It calms everything down. Research has proven that due to the common estrogen dominance associated with fibromyalgia, progesterone is often very low in fibro patients, and evidence has shown increasing levels of progesterone does lead to improved pain outcomes in fibro patients. Testosterone, which is predominantly thought of as a male hormone, plays a vital role in women's health beyond its reproductive functions. Testosterone contributes to the overall intricate hormonal symphony governing pain perception and inflammation. Remember that in women, most testosterone is converted to estrogen. This follows in line with the fact that many fibro patients also have low testosterone, which has proven to be correlated with increased pain sensitivity going back to its anti-inflammatory roots. Testosterone plays an incredibly crucial role in regulating the body's pain response. But of course, it doesn't do this alone. It interacts with the other hormones and the other pathways, creating a ripple effect in the complex network of our pain modulation systems. One other thing that I forgot to note is that with estrogen dominance and hormone imbalances in general, the numbers don't necessarily have to be, frankly, low or out of range. What matters is where they are at in comparison to their related hormones. It's the ratio to its counterparts that matter most with all of our hormones. Let's continue moving on from our stress and sex hormones to another organ that is interconnected with both stress and sex, our thyroid. Our thyroid is a little butterfly-shaped gland located in our neck that plays a pivotal role in regulating various bodily functions. One key aspect of thyroid health and fibromyalgia is the interconnection with an underactive thyroid or hypothyroidism, which leads to a myriad of symptoms, such as fatigue, muscle pain, cognitive difficulties, and constipation, to name a few, symptoms that I'm sure we can all agree overlap significantly with fibromyalgia. In fact, thyroid conditions are often left unaddressed in fibro because often symptoms are just lumped into that fibro category without any further workup. Unaddressed hypothyroid can obviously exacerbate the already challenging symptomology of fibromyalgia. The thyroid produces hormones that influence our metabolism, energy production, and overall function of our organs. Disruption in that thyroid function, whether due to hypothyroidism or an autoimmune condition that affects the thyroid like Hashimoto's, can have cascading effects on the body's ability to manage stress, regulate energy, and modulate pain responses. The autoimmune component of thyroid dysfunction is actually particularly relevant in fibromyalgia as well. Hashimoto's is more prevalent in individuals with fibro because the autoimmune attack on the thyroid can create a pro-inflammatory environment in the body, increasing pain sensations. Our thyroid is also connected to the hypothalamus and pituitary gland, so an imbalance in thyroid hormones will upset the HP aspect of the HPT axis, once again further disrupting the HP aspect of both the HPA and HPO axes. It's a lot of HPs. No hormone imbalance basically exists on its own, and merely prescribing a medication to fix the thyroid imbalance is not enough. And that goes for fixing any hormone imbalance. It's not enough to just slap a Band-Aid over the situation and call it good. This is why so few quick fix treatments for fibromyalgia work. We need to address the entire axis in order for true symptom resolvement. As I mentioned earlier, if estrogen is dominant, it's dominant over another hormone, progesterone. The same can be said for all hormones, including the thyroid, because they all exist together in a symphony. It's not just that the trumpets are playing too loud, but that the flutes are playing too quietly. It's both sides of the coin. Here's a quick review slide indicating the common hormone imbalances associated with fibromyalgia that I've gone over today. We often see low cortisol, progesterone, and testosterone, and high estrogen and thyroid stimulating hormone. There are, of course, many more hormones in the body and many more imbalances possible. There have been studies that have shown many other hormone deficiencies and or surplus associated directly with fibromyalgia, but for the purpose of this talk, I couldn't fit them all in. So the question of the century is, what do we do about this? What are our next steps, and how the heck do we regulate all of these hormones at once? First things first, we have to regulate the sympathetic nervous system. We have to learn how to save the sympathetic nervous system for times of need and experience our parasympathetic nervous system a little bit more. While the sympathetic system is our fight or flight response, the parasympathetic is the rest and digest. This is what is active when we are at peace. We've all heard the tools to regulate the nervous system like mindfulness, exercise, eating a healthy diet, laughter, etc., etc. I could go on and on. While those things are, of course, incredibly important, I wouldn't be a naturopathic doctor if I didn't think so. But one thing that isn't talked about too much is vagal nerve stimulation. The vagus nerve is our longest cranial nerve. You can see in this blue picture on the right that it is huge. It goes from the brain all the way down into our abdomen. It's our longest cranial nerve. It is the gateway to the parasympathetic nervous system. It acts as a communication highway between our brain and our major organs, helping to regulate bodily functions and maintain our homeostasis, or that status quo. Stimulation of this nerve involves a targeted approach to promote a shift from the sympathetic nervous system dominance to parasympathetic activation, from fight or flight to rest and digest. Vagal nerve stimulation has been linked to a reduction in inflammation, obviously a key factor in many chronic conditions, including fibromyalgia. By dampening that inflammation, vagal nerve stimulation contributes to alleviating many symptoms associated with fibro. It also helps to lower heart rate variability, improve blood flow to our gut, kidneys, and bladder, therefore reducing GI and urinary symptoms associated with fibro. Stimulation can be done with certain breathing exercises and biofeedback techniques. Incorporating vagal nerve stimulation techniques on your own into your daily routine can be a very valuable aspect of managing acute fibro symptoms while your doctor addresses the intricate connections between all of your bodily systems and hormones. I saw a quote when doing research for this talk that said, "It's likely that fibromyalgia is a more composite of symptoms than a specific disease, so it's best to focus on alleviating symptoms rather than searching endlessly for a definitive diagnosis." In my professional opinion, this is very lazy healthcare. It's important to address the symptoms in an acute stage because no one wants to be in pain or uncomfortable, of course. But when a patient is facing a chronic disease, only addressing the symptoms is how we've found ourselves in this predicament of no one really understanding where fibromyalgia came from or why it exists. Your doctor should take the time to work with you to learn the ins and outs of your chronic condition so that they can use their clinical knowledge to figure out the why. That's why I went to medical school, so that my patients don't have to do all of their own research and guess the cause of their fibro or other chronic disease. For those of you out there who have fibro and haven't had a doctor really listen to you or really question your why, here would be the beginnings of my approach to figuring this out. You can present these ideas to your doctor, and hopefully they'll be open to digging a little bit deeper with you guys. I think lab testing is incredibly important, not just for figuring out where the hormone imbalance is, but to learn more about your inner chemistry of your body and understand where else inflammation could be coming from. This is kind of a starting panel of where I would start with labs. It would change patient to patient, but this is in general. And then once we get the hormone imbalances identified, you can start treating with supplements, herbs, lifestyle to regulate that HPA axis and address the nutritional needs to heal from the inside out. I also put on this slide one of my favorite adages. If you are diagnosed with a chronic disease like fibromyalgia and your doctor gives the diagnosis and says something along the lines of, "Here are your treatment options, but there's not really anything else that we can do. It's symptom management from here on out," or something like that, it's most definitely time to find yourself a new doctor because that's not healthcare. The conversation should never be over once a diagnosis is reached, and you deserve better. These are my resources. That's all I have for you guys today. Thank you so much for showing up and listening to my talk. Here is my contact information. Feel free to send me a message or email if you have any questions that don't get addressed today. And I think now we can open up the floor for questions.
Thank you so much. It's tremendous information. There's a lot to unpack here, especially when hormones are involved, and a lot of questions too will come up regarding hormones and even thyroid, because we have a lot of questions too with Hashimoto's coming up and understanding that's relationship on the autoimmune side that people tend to ignore. So there's two, correct? With the thyroid, it's the Hashimoto's or Graves that become the autoimmune.
Yes, Graves is the more hyperthyroid side of things.
Okay, so hopefully that answers. Someone was asking about the severity, because I think sometimes when you're told thyroid, it's people or Hashimoto's, people don't know that is the autoimmune. So part of it. So please definitely address any autoimmune conditions you have along with fibromyalgia, because there is overlapping.
Absolutely. And so you can have hypothyroidism or hyperthyroidism, and then the autoimmune aspect of both of those conditions is Hashimoto's or Graves. And the autoimmune piece means that your body is creating antibodies against itself, essentially. So it is fighting. So a Hashimoto's case would be that your body is creating antibodies against your own thyroid, and you are fighting against your own thyroid, essentially. So definitely get that fixed if you've ever been told that you have that.
Well, one thing we've noticed too is that you're given the prescription but then you're left. So we've seen people that have been taking the same dosage and the same medication for the thyroid treatment for many, many years and don't get it rechecked and to look at. So I love the way that you've connected the dots on actually management. And you took away one of my questions on like where to start. So we appreciate that slide of having people just to be able to understand like that it's multifactorial, there's different systems involved, and it's important to address all those symptoms. I do have one of the questions just to kind of start it out, just to let people know and get familiar with naturopathic medicine, because I think naturopathic doctors are our friends, our biggest allies in this because of understanding and how you were trained. Do you mind sharing a little bit more on the medical training? Because I know when you talk to the naturopathic doctors and the schools, they call it medical school. That's what it's referred to. So do you mind just giving us a little bit of a top level of the training as well?
Absolutely. So naturopathic medical school is 4 years of medical school. It's the same time period that traditional MD or DO school goes through. We take the same boards. We take the same clinical assessment tests. We have all of the same pathology courses. We can prescribe pharmaceuticals. So we are trained in pharmaceuticals as well as minor surgery techniques. So it's not just herbs and lifestyle that we throw at people. Naturopathic medicine, we're really focusing on the therapeutic order. So we start at lifestyle and the least, invasive techniques. So we are trained in obviously the more invasive techniques, and we have gotten all of that pathology training, but we're also just focusing more on fixing things at a root cause level instead of putting Band-Aids on things and calling it good, essentially.
Right. Or managing the symptoms, as we talked about with Dr. Pinkston. You go to the specialist over here, you go to the specialist over here.
Exactly.
And then you end up walking away potentially with a lot of medications, and nobody's looking at your whole chart because our poor primary doctors are overwhelmed. So it's hard to manage. And this is something that comes up quite a bit. And that's why it's great to have these discussions. And I know, Danielle, I want to throw it over to you to see if you have questions too, and we'll get to some of the questions in the chat.
Oh, how many questions do I have? Wow. So, being a naturopathic doctor, I know that not all of us have access to that. But as a naturopathic doctor, you said that you can diagnose and use laboratory testing, in most places legally. Well, one of my questions was, should you test for Hashimoto's if you have fibro? And how does that play into what, like, my primary physician would treat me for? Because I've been told that there's no point in testing for it if they're not going to treat me any differently. I know it's a very long-winded question. I'm sorry.
No, you're totally fine. The last part, I just don't understand why some doctors say that. It just bothers me. Because I think that information is key, and understanding why something is happening in your body is incredibly important. So I would always vote for testing. Why not? Why not know more about your body? In regards to the primary care aspect, your primary care can run thyroid tests. And how I was trained personally is that if you have hypothyroidism, you are tested for Hashimoto's. All of your thyroid hormones are tested, not just that TSH number, because that can be normal, and the T3 and T4 can be totally left field. So testing all of the thyroid hormones and also testing for the thyroid antibodies is, in my opinion, first line if someone comes back with a positive hypothyroidism.
Okay, yeah. I just seeing the difference between sometimes MDs and DOs, and NDs, it can be a lot of difference in philosophy as to how they're actually treating the patient. I just wanted to make sure that everybody knew that.
Yeah, I really believe that patient education is key, and why not know more information about your body?
Right, me too. Also, there is another question. So there's a lot of places that say that fibromyalgia is a more woman-centered disease. So what is happening there when a man we do have quite a big population of men that have fibromyalgia?
Absolutely. And it can definitely affect both sexes. I think it really is that ratio in hormones. Just because estrogen is more considered a female hormone and testosterone is more considered a male hormone doesn't mean that it's that way in everyone. And everyone has estrogen and everyone has testosterone. So those imbalances can just be a little bit different in both sexes, and it affects everybody the same way. Does that make sense?
Oh, yeah, that does make sense. Thank you so much.
Yeah.
Well, and it is complicated with hormones, and having worked in the Alzheimer's space where we see a lot of predominantly women and a connection to the menopause and decrease too with estrogen, or when they've been decreasing their estrogen through supplementation and things like that with medical training. So it's across the board addressing some of these hormone aspects, but it's so complicated. As you mentioned, there's so many HPs involved.
So many HPs, yeah.
And with the hypothalamus, and as Chloe just mentioned, talk about the thalamus with any of the endotoxin exposures too, we get really complicated. And so this is where these connections between even men and testosterone can come in, and it's a lot. That's why it's a lot to take in, and then it's a lot as patients to try to navigate the system and what do we do when it comes to that. But I appreciate you sharing on this testing aspect, because a lot in functional medicine we talk about test, not guess, or being able to ask for it. The complicated thing is asking for it. So when it comes to asking for these tests, if we aren't seeing a naturopathic doctor, can primary care order some of these tests under insurance?
Yes, all of those tests should be covered by insurance.
Okay. Yeah. Well, and
primary.
I think with naturopathic medicine, it's fascinating to actually go into this, and we will be giving more links. We talk about naturopathic medicine a lot on our channel because I'm a big supporter of just finding and be able to network with people. And you have a vast network of colleagues as well that you have networked with.
I do, yeah. I'm happy to send links out as well with great fibro doctors. I know that everyone lives in different areas and rules are very different depending states by state and country by country, but I would be happy to send out referrals as well.
Yes, there is a difference of scope of practices for each of the states when you're working with an ND, which makes it complicated. But I know there is advocacy work being done, which we love our advocacy work. So we can support what's being done on that front to expand scope of practice, because certain states actually don't allow it. I think New York is the funny one, right?
Yeah. No, and in New York, NDs are not allowed to diagnose or order lab tests or anything like that. But I have heard that we are on our way to getting that. So I'm excited.
And there are workarounds around those things.
Well, we've heard some of the workarounds, but this idea too, as patients, we can actually support the expansion of this because it's well needed, and there's millions of fibromyalgia patients out there. So you can also bring this up to your congressional representatives, the state legislator, to have this expansion because it is a need. So this is how we are all working together as a community to advocate and move forward. And speaking of supporting you also, let's talk a little bit about this podcast.
Yeah. So it started as my community education project for school, and I did it and it was super fun. I loved it. And then I was like, okay, I'm done with my hours. And everyone was like, no. You don't get to stop. You have to keep this up. So it just kind of bloomed into this thing. And I love it. It's so much fun. I love getting to educate women about their bodies and as I said, I don't think that you need a medical degree to understand your body. And I think that this is why we're all here. There's so much gatekeeping in medicine, and that sucks. And I don't think that it should be that way. Just hard stop. And so the podcast is there to educate people about their bodies so that they have the advocacy to go to their doctor and say, I heard this and I want to get this tested, or I think maybe I have X, Y, and Z. Can you look into this a little bit more? So that's really where the podcast started and grew from into this thing. And I love it. It's so much fun. And just getting to hear people's responses to it has been really awesome.
Yay, we're celebrating your work when it comes to
Thank
this.
you.
And just, again, breaking down the barriers to education is very important, especially here for patient empowerment. Because as you've seen probably in all our discussions, kind of fall in the middle where the patient tends to have to do a lot of the education and research and then bring it back to the providers unless we're working with someone like yourself. So
Yes.
anything that we can grab onto and be like, hey, this will help with speaking to our provider is useful for us.
Yeah, I've been in that position where I've been educating my doctor and I've been asking for all of these things. And they're like, well, we just don't really know. And I don't think that that's healthcare. So I want to prevent other people from having to do that for sure.
Yes, that is so helpful. And I did want to just ask I was seeing this question, obviously, that may, just to get people on the same page, because I've seen it come up a few times, is this estrogen level, do we want to decrease it? I know this is complicated because everybody breaks down estrogen differently and in different pathways.
It definitely depends, I would say, with any estrogen dominance, though. As a reproductive age female, it is important to lower that because it can have detrimental effects at a too high of a level, and it causes all of those yucky symptoms, and nobody wants that. So I think that in general, and this is not medical advice, but lowering estrogen levels if you do have an estrogen dominant picture is definitely important in a lot of people.
It is. It's hard. And we get a lot of these conversations where it sounds like people are more estrogen dominant. And you've covered all this breadth of topics with cycles, menopause, thyroid issues. So that's why I encourage everyone to, this presentation will stay recorded for everyone to rewatch. And at the end of the day too, you can go back and watch all of today's presentations. Then we're going to break up the content individually. So that way you can watch just this presentation too. And we welcome you back as well, because what's in store for you for 2024?
Me?
Yes. Sorry.
I'm just opened my practice, so continuing to let my practice grow and learning things from there.
And Portland?
Yes.
So you're currently accepting new patients in the area?
I am, yes.
We do get questions on insurance, and I know it varies based on that and coverage. So I think we can let you answer those questions in the chat, and we can get more people information about your practice. But you do treat men and women, all genders, correct? Okay.
I do. I am technically a primary care provider. I just specialize in women's GI and hormone, and I do take insurance. I know that there are NDs out there who do not, and it varies state by state and doctor by doctor. So it really depends.
Well, we appreciate you answering these questions too, and just answering what the difference are. I see another question, if you don't mind, more of going over vagal nerve stimulation a little bit. Like, is there a description that we can kind of relay? Someone missed a little bit of that.
Yeah, so vagal nerve stimulation is just really focusing on activating that parasympathetic nervous system, calming down the sympathetic nervous system. It can be done through means of breath work, massage, biofeedback. There are devices that you can purchase that sit on your body and do that for you. I'm not quite sure of the science of that aspect of it. I am more into people doing it through breath work and on their own at home, just because that's a little bit more accessible to people. it's very important in retraining the body to get out of that sympathetic nervous system dominance area, which a lot of fibro patients exist in. And I think a lot of people in general in our world right now are existing in that fight or flight response. And the parasympathetic nervous system is what helps us to rest and digest. As I said, it's what encourages a lot of movement and repair in the body. So it's very, very important to figure out how to stimulate that response a little bit more and calm down the anxiety piece.
Yes, and I know we all have some anxiety about doing a live production right now. So all of us can be in sort of flight or fight state and just understand that there are these middle grounds, especially to our co-host. And people are saying thank you so much for all the presentations that are on here today. Danielle, any last minute questions before Dr. Adriane leaves?
No, just thank you so much. All your information like solidified what I've been feeling as a person with fibro. So it makes me understand just a little bit more what's going on. So thank you.
Thank you so much for having me.
Yeah, thank you so much for presenting. And again, we're going to digest this content. I do believe that we will be bringing back presenters in the new year. We might do pre-record so we avoid all this stuff. And like, you never know. But podcasts are great because it's audio. And so everybody will include all the links so you can go subscribe to the podcast and just get updated and stay in the loop. But thank you so much for joining us today,
Absolutely. Dr. Thank you so much. Have a great rest of your day and happy weekend.
I know it's Friday.
Yay.
Okay. Bye.
All right. Thank you so much.
Thank you to all our fibromyalgia friends. Danielle, we did it. We made it.
We made it. Yay.
Now Danielle gets to celebrate more of her birthday for the rest of the day. And hopefully we can enjoy and how you can rest and relax.
Oh, yes. The rest of the day is definitely going to be trying to calm that nervous system now that I'm all ramped up and excited.
I know it's stressful. It's a good thing, but there's a lot of stress involved in doing the live production when it comes to hosting this event, because you never know. I feel like the tiger of the internet is coming at us and waiting, lurking in the background. Please, please stay. And then we have all these like spammers we're keeping an eye out for potentially and making sure. But we're all having fun, and that's a thing. And I appreciate Danielle being here with us and having post-birthday celebrations. Danielle, we are definitely going to have to do an interview with you at another point so we can have you share your story with the community and all the advocacy work that you continue to help and support us with. We're going to continue to nerd out on the science. So we're going to bring you back in.
Absolutely. Sounds good.
Well, thank you for co-hosting today with me, Danielle. I'm going to close out the conference for everybody here with a special tribute to a friend of our organization as well. But please, just as a reminder to keep sharing this content, like the content, share it with other fibromyalgia community friends. It really makes a difference. And we want people to know that they have the education and support and empowerment to live and improve their quality of life, empower their own health here. And it's super important, as you've seen, that we need to increase that advocacy, not only at the clinic side, but at the Capitol Hill side. So we appreciate everyone tuning in. Tomorrow, we are back live in action. Do not miss it. It's 10 a.m. Eastern time. We will be here with Dr. Michael Lenz. We also have Jill who's going to be doing a live demo with us. Everything is live. So with doing myofascial release, we're going to be demonstrating some of that. She's going to talk about the fascia and how it impacts our nervous system and our pain. Then we're going to jump into Elaine with going through a nature walk. So we're going to hopefully slow things down with our nervous system and go through that nature walk together. We have the Specific Chiropractor Center of San Diego. They're going to be jumping on too for their live stream. And then we welcome Kelly from More Than Lupus, who's going to talk about patient empowerment, support groups, being a patient organization and advocacy group together. That's for the first half of the day. Okay, so that's only part one of Saturday. Later in the evening, we're going to go international. It is Saturday Night Live. We're going to be US and Taiwan joined. You're going to hear from all of the advocates over in Taiwan, including Carrie from My Several Worlds. There may be some other special guests and some fun that goes on behind the scenes. You never know. So get the rest tonight, because tomorrow we are going to be jumping from the morning to the night. Gonna have some fun. You never know when you might see some Pause for Fibro special guests as well throughout the stream. So come on back tomorrow, everybody. And I'm again going to close out the conference. We appreciate everyone being here. Thank you, Danielle. Thank you to all our fibromyalgia friends and all the speakers that have joined us today, everybody supporting this event. We really appreciate you. So let me actually honor someone here. And it's definitely someone that, I have to remove myself off. Let me try this again. So I need to get off the stage and move myself, but I can't do this. Okay, so I'm not sure if this is going to work for exactly what I need. So I apologize, but I wanted to definitely honor Dona Campbell. She was an amazing advocate and supporter for all that we do. And I will come back with a picture. We'll upload it to the stream at another point in time as well. She passed away last year, and she didn't get a chance to see the conference. And I just wanted to give her a special message to thank you for all her support and love that she gave to her and her family. They were huge supporters of this organization and to the fibromyalgia community. You may have connected with her on Facebook. She really wanted to see change for all fibromyalgia patients out there, and she wanted to see change, especially in the medical field. She brought a lot of hope to many of us out there. I still see her Facebook memories that she posts. She's wearing our Support Fibro t-shirt, our advocacy t-shirt everywhere she went. She means a lot, and all her love for the community. She has such a huge heart. Thank you so much, Dona, for being one of also the earliest adopters who encouraged me to go back to school for medicine. I really hope that one day I can share that diploma with you. We all miss you. So sending everybody out there love to all our Support Fibro friends. You have a lot of love in this community. Stay connected, and we will see you tomorrow.